The main purpose of our Center for Biomedical and Minority Health Research is to address the existing disparities and inequities in healthcare, especially among our underrepresented minority populations here in the United States, and more specifically for us in Harris County and Greater Houston area. We have several research areas here, and my lab mainly focuses on maternal health and child health research in terms of epidemiology work, looking again to close those gaps in health disparities here in our Greater Houston area and Harris County. The other type of research that I do is drug discovery and development research, where we look for new medicines for specific infectious diseases. For example, with the outbreak of the recent COVID-19, SARS-CoV-2 that led to the COVID-19 pandemic, our lab is looking at repurposing some clinically approved drugs to work with the FDA to push some of those to be repurposed for the treatment of COVID-19.
My research is rooted in Texas Southern University and the community around that. So with that, I focus on disease such as cancer, infectious disease, diabetes, etc., and most of them disproportionately impact the minority. And for example, prostate cancer and breast cancer are the two major focus of my research. And they have obvious disparity for African Americans, men or women. So with that, with our nano formulated drugs, we try to reduce the disparity and improve the patient compliance. Recently, our work have been recognized as a National Cancer Institute, which is part of NIH. We become one of their subcontractors for preclinical drug development. There total 19 institutes get that subcontract, and we're the only one from Texas, and we're the only one, the only HBCU get that contract. So I consider that's a great recognition of our work.
Our research is very unique, and we are in the area of gapping the drug discovery toward actual marketing of a drug product. So our facility is very unique, at least in the Texas Medical Center area here, as well as in the state of Texas. That's why we have the CPRIT funding to support our center to provide this type of service. And we have gained a lot of experience as well as a lot of collaborations with investigators across the Texas Medical Center and the state of Texas.
When it comes to disparities in maternal mortality, our country nationally, the United States, is doing really poorly compared to other developed countries. So the work we do is very key in addressing the underlying causes and looking at the root causes of those disparities and poor maternal health outcomes. And so that's what our lab does. We work with a huge center. We just received a huge funding from Health Research Services and Administration to address and improve maternal health in the Harris County and Greater Houston area.
One of the ways that we've seen kind of real-world engagement and impact is through a collaborative that has been born out of the Community Engagement Corps in a partnership with the Gulf Coast Consortia to develop a community-engaged healthcare educational program. So it's really been exciting to provide this educational opportunity where the community is educating our clinicians and our researchers in how to do this better, and how to develop and deploy, make available important life-saving interventions and technologies.
For me, it's all about watching the light bulb turn on, the fire get lit again or rekindled in our participants' eyes. And that's been the huge payoff for me, to see faculty come into being, become more excellent at what they're doing, to see the energy come back again, and it spills out into the students. They're happier people. It was just very rewarding.
CPRIT stands for Cancer Prevention Research Institute of Texas, and within the name itself, it is cancer prevention. So we applied for this funding mechanism under the prevention pillar of CPRIT, which positions us or allows us to be able to offer mammogram at no cost to uninsured and underinsured women. So with that, we are addressing a major barrier for that population. The fact that we're able to provide services that is a bit more convenient, accessible and specifically at no cost to uninsured, underinsured women is a big, it's a big priority for CPRIT, and we are very grateful to have been able to receive that.
One of the great things that are coming next in the future and that we're working on, because we like to think ahead and work ahead, is that the university has deployed a lot of infrastructure for artificial intelligence when it comes to artificial intelligence, the marriage between artificial intelligence and social determinants of health. So our core facilities here at Texas Southern University, we've deployed a lot of infrastructure, resources, and capacity into studying the role of artificial intelligence and addressing a lot of these disparities within maternal health, and even using artificial intelligence for drug discovery and development. We hope that in the future, with all our work, we hope to see that the synergy of working together with the key stakeholders will really move the needle when it comes to reducing breast cancer health disparities within our community that we serve.
I remember this young lady, she had just gotten vaccinated. She's African American, and she goes home and she talks to her grandmother. Grandma, you need to be vaccinated. Grandma says, absolutely not. I don't trust the healthcare system. I don't trust any of these people. I'm not going to get vaccinated. The young lady says, well, Mom, the lady who vaccinated me is African American. She says, well, in that case, take me, I want to get vaccinated. The message is important, but so is the messenger.
Data and science and study have shown that African American individuals are much less likely to be enrolled into a clinical trial. So the EQB Med initiative is going to address this major and critical problem in our community.
EQB Med initiative positions us at Texas Southern University to actually have access to innovative and breakthrough clinical studies. We do a lot of work to increase awareness about clinical research participation, but without an opportunity to actually open access for individuals to participate and to build trust in clinical trial process, we are very limited.
Pharmacy is a very important team in communication with the community. And we are not only have our PharmD program, we also have a PhD program. With that, we have more outreach to the community.
We are the #1 producers of African American pharmacists in the state of Texas. Pharmacists are a significant part of the healthcare team. They're able to immunize patients. They're able to help them in a variety of health settings per se.
TSU had the RCMI support back in 1980s, especially in terms of research infrastructure. So the students and scientists can conduct most cutting edge of research, especially in the area of drug discovery and development.
In 2024, the College of Pharmacy and Health Sciences celebrated its existence of over 70 years. We lead a lot of initiatives advancing health equity, training community health workers, providing continuing education for community health workers, as well as for our pharmacy and health administration students.
In this initiative, we are going to partner with UTMB, Yale University, and Morehouse School of Medicine. We will be able to gain more experience and resources and guidance on how to recruit for clinical trial and how to conduct clinical trials.
So this clinical research initiative under the EQB Med funding mechanism allows us not just to provide opportunities for clinical trial participation for community members, but it creates a platform for us to train the next generation of pharmacists that will be culturally competent, that will have an high level of awareness of engaging with community members to promote the concept of diversity and equal representation in clinical research participation.
I'm Monica Olaleye, Director of MH Reach, a center focused on advancing women's health through research, education, and community engagement for underserved populations in the world's largest medical center.
To date, we've trained over 125 maternal health professionals with over 20 publications by analyzing over 60 million women in America.
We have provided several health education conferences reaching over 1,000 people. With the Action Grant, we will scale up the integration of mental health services to promote holistic well-being through licensed professional counselors and social and community health workers.
MH Reach is implementing medication therapy management, mental health services, and cultural healthcare models for refined care. We focus on improving health among underserved minority women during prenatal, pregnancy, and postpartum.
Our innovative approach uses advanced biomedical and epidemiological tools focused on community-driven solutions and strategic partnerships for transformative change in women.
Using advanced AI tools and development of women health toolkit, we lead maternal health research, reduce disparity, and ensure quality healthcare in the region.
We empower women, healthcare professionals, and families through community and global health education and advocacy.
Through culturally responsive training, we are increasing the maternal health pipeline and workforce and creating sustainable models for global impact.
Together we create systemic, national, and global change.
Transform maternal health,
improve women's health, and advance health equity.
and ensure that every mother not only survives but thrives.
Hello, my name is Veronica Ajawale Mwema. I am a professor of pharmacy practice here at Texas Southern University, where I also have the privilege to serve as the Assistant Vice President for Clinical Translational Research and Community Engagement. I am the founding director for the TSU Health Mobile Unit Initiative, and I am very excited to share this initiative with you. The TSU Mobile Health Unit is a 40-foot, fully equipped, wheelchair-accessible, telehealth-ready mobile unit with a screening mammogram room, clinical services room, and a community engagement room. There is an expandable awning on both sides of the TSU Mobile Health Unit with a large screen outdoor TV on the outside panel for community education. This allows us to engage with community members outdoors while also providing various clinical services inside the unit. The back panel of our mobile unit allows us to highlight our different programs and sponsors. We are extremely delighted to share that the TSU Mobile Health Unit has capacity to bring cancer screening and health services directly to you in the community.
The community engagement room in our mobile health unit provides a private space for patient check-in as well as community engagement activities. This room also features a TV screen that allows our community members to view educational programs while waiting to receive clinical services. Our wheelchair-accessible mammogram suite is equipped with a state-of-the-art mammogram equipment, allowing us to offer high-quality 3D screening mammograms in the community.
Our state-of-the-art clinical service room on the unit allows us private spaces to provide clinical services and preventive health care services, including high blood pressure screening, hemoglobin A1C for diabetes, and cholesterol screening, as well as lab sample collections that can be stored in our hospital-grade refrigerators or freezers. The room is also telehealth ready, allowing us to connect several rural communities with clinical services seamlessly.
We can also engage with the community about different clinical research initiatives, including enrollment in our clinical research registry, evaluation for interventional or non-interventional studies, as well as educating the community about various clinical research programs.
This private space allows a community member to engage with a clinical pharmacist, answering medication-related questions and providing the needed support to improve health outcomes.
The TSU Mobile Health Unit Initiative also positions TSU to lead the way in civic engagement, research, and training of future healthcare professionals and social support staff who have a deep understanding of the community and a commitment to advancing health outcomes in the community.
This is TSU Mobile Health Units. bringing cancer screening and health services to you.
I remember this young lady, she had just gotten vaccinated. She's African American, and she goes home and she talks to her grandmother. Grandma, you need to be vaccinated. Grandma says, absolutely not. I don't trust the healthcare system. I don't trust any of these people. I'm not going to get vaccinated. The young lady says, well, Mom, the lady who vaccinated me is African American. She says, well, in that case, take me, I want to get vaccinated. The message is important, but so is the messenger.
Data and science and study have shown that African American individuals are much less likely to be enrolled into a clinical trial. So the EQB Med initiative is going to address this major and critical problem in our community.
EQB Med initiative positions us at Texas Southern University to actually have access to innovative and breakthrough clinical studies. We do a lot of work to increase awareness about clinical research participation, but without an opportunity to actually open access for individuals to participate and to build trust in clinical trial process, we are very limited.
Pharmacy is a very important team in communication with the community. And we are not only have our PharmD program, we also have a PhD program. With that, we have more outreach to the community.
We are the #1 producers of African American pharmacists in the state of Texas. Pharmacists are a significant part of the healthcare team. They're able to immunize patients. They're able to help them in a variety of health settings per se.
TSU had the RCMI support back in 1980s, especially in terms of research infrastructure. So the student and scientists can conduct most cutting edge research, especially in the area of drug discovery and development.
In 2024, the College of Pharmacy and Health Sciences celebrated its existence of over 70 years. We lead a lot of initiatives advancing health equity, training community health workers, providing continuing education for community health workers as well as for our pharmacy and health administration students.
In this initiative, we are going to partner with UTMB, Yale University, and Morehouse School of Medicine. We will be able to gain more experience and resources and guidance on how to recruit for clinical trial and how to conduct clinical trials.
So this clinical research initiative under the EQB Med funding mechanism allows us not just to provide opportunities for clinical trial participation for community members, but it creates a platform for us to train the next generation of pharmacists that will be culturally competent, that will have an high level of awareness of engaging with community members to promote the concept of diversity and equal representation in clinical research participation.
Hello, I'm Monica Olaleye, Director of MHREACH, a center focused on advancing women's health through research, education, and community engagement for underserved populations in the world's largest medical center.
To date, we've trained over 125 maternal health professionals with over 20 publications by analyzing over 60 million women in America.
We have provided several health education conferences reaching over 1,000 people. With the Action Grant, we will scale up the integration of mental health services to promote holistic well-being through licensed professional counselors and social and community health workers.
MHREACH is implementing medication therapy management, mental health services, and cultural healthcare models for refined care. We focus on improving health among underserved minority women during prenatal, pregnancy, and postpartum. Our innovative approach uses advanced biomedical and epidemiological tools focused on community-driven solutions and strategic partnerships for transformative change in women.
Using advanced AI tools and development of women health toolkit, we lead maternal health research, reduce disparity, and ensure quality healthcare in the region.
We empower women, healthcare professionals, and families through community and global health education and advocacy.
Through culturally responsive training, we are increasing the maternal health pipeline and workforce and creating sustainable models for global impact.
Together we create systemic, national, and global change.
Transform maternal health,
Improve women's health and advance health equity.
and ensure that every mother not only survives but thrives.
Hello.
Hello, my name is Veronica. I am the Director for the Community Engagement Core here at Texas Southern University. Thank you so much for taking time to join us for today's program. You could have been doing so many other things today, but you chose to make time to join us for today's program, where we will be focusing on maternal and child health outcome in our community. Sit back, relax, enjoy the amazing presentations that will be coming from our speakers, experts, panelists, and also remember to stop by and visit with our vendors and exhibitors. There's a lot of great information that will be shared today, so I look forward to an amazing conference today alongside with each of you. Thank you again and see you around.
All right. Good morning, everyone. Welcome to the Steve Raddick Center, where we are hosting our 4th annual Maternal and Child Health Education and Outreach Conference. This is co-hosted by CBMHR, our Center for Biomedical and Health Research, and MHREACH, our Maternal Health Center at Texas Southern University. We're hoping that everyone out there, whether in person or online, is staying warm and safe, and we welcome you to learn more about maternal and child health today. I will now be first introducing our Master of Ceremony for the morning session, Dr. Jasmine Jones. Dr. Jasmine Jones at Texas Southern University graduated as a licensed pharmacist and is dedicated to advancing patient health outcomes through safer, more effective, and accessible medication use. Her passion for patient-centered research began during pharmacy school and deepened through rotations with Pfizer and the U.S. Food and Drug Administration. Currently, Dr. Jones serves as a postdoctoral fellow within Texas Southern University's Maternal Health Research Center, MHREACH, and for the Center for Biomedical and Health Research's Community Engagement Core, where she works to define and expand the role of pharmacists in reducing maternal mortality through medication management and community engagement. I'll now welcome to the stage Dr. Jasmine Jones.
All right, good morning, everyone. Oh, sorry, got to keep the mic to my mouth. Good morning, everyone. I'll be your MC for the first half of today's session. Thank you so much for taking time out of your Friday morning to learn a little bit more about maternal care. So first, I will be introducing who will be giving our introductions and agenda overview, and they will be given by Dr. Ivy Poon. Dr. Poon is a professor in the Pharmacy Practice and Administration Department in the College of Pharmacy and Health Sciences at Texas Southern University. Dr. Poon received her Doctor of Pharmacy from the University of Houston and a Master's of Science in Palliative Care from the University of Maryland in Baltimore. She is a licensed pharmacist and preceptor in the state of Texas, and has served as a clinical pharmacy specialist and preceptor for pharmacy students at the Geriatric Clinic and the Michael E. DeBakey VA Medical Center in Houston, Texas, for more than 20 years. Dr. Poon has served as a mentor for many junior faculty in research and professional growth. Her research interests are geriatric pharmacotherapy, palliative care, and pain management. Please welcome up Dr. Poon.
Thank you so much, Dr. Jones. Thank you. Welcome. It's so nice to see everybody today. We're so excited. Welcome to the 2026 Maternal and Child Health Education and Outreach Conference. We are so excited. We have a full lineup of activities planned for today. And starting with opening prayers, and we have our keynote speaker speaking about on the topic, this very important topic. We will also have a panel discussion, and also the Texas Southern University debate team will come and present. And also we have some highlights of our wonderful MHREACH Maternal Health Research Center activities. So we are so excited. This is a schedule that is listed, is also listed in your booklet. When you open up your booklet, you will see there is on the first page, there will be an agenda. So anytime if you would like to refer back to the agenda, you can take a look on the first page of your booklet. We want to thank you, our partners, including Harris County Precinct 4, BC Wellness Center, and also Harris County Public Health, and the Rose. We want to thank you, our sponsor, and also all the wonderful vendors who come here today to make it possible for us to host this event. Thank you, thank you. Now, also in your binder, you will see there is a notepad. The notepad can be used for you to, if you have any questions while listening to today's event, you can write down your questions. Periodically, we will have some Q&A sessions. Then there will be a chance that you can ask some questions to us. If you are joining online, you can also type your questions in the Q&A box, and we will answer that accordingly. There is a QR code that is in your booklet. It is on your first page of the agenda right here. We would like for you to fill out your comments later on, anytime during this conference. Provide us some comments and feedbacks and provide us some potential topics that you want to hear about in the future programming. So give us some feedback, please. It could be done anytime during this event. So from now until all the way until 1 to 2 p.m. So you could do it anytime you would like. If you are a community health workers and you're joining to gain the community CHW continuing education credit, today's programming is worth 3 hours of CHW credit. So please fill out the QR code to gain the community health worker credit hours. And our programming is being broadcast on Facebook and YouTube. So please help to share with your family and members. If they cannot join, they can still join online. So thank you very much, and thank you for joining today.
Thank you, Dr. Poon. All right, moving right along into our opening prayer. The prayer will be given by First Lady Janice Pinder. First Lady Janice enjoys serving alongside her pastor husband at the Fallbrook Church in Houston, Texas. Together, they have witnessed God grow Fallbrook Church from 5 families to over 10,000 members. She serves as a ministry leader, a Bible teacher, and a conference speaker to women. She has mentored and counseled hundreds of women in various life stages and develops programs encouraging their success. Her passion leads women to ignite with hope through a deeper relationship with God. First Lady Janice received a bachelor's degree from the University of Houston downtown, a master's degree in professional writing from Liberty University, and is working towards an EDD in leadership at Tribeca Nazarene University. Please give it up for First Lady Janice Pinder.
Thank you. It's a blessing to be a part of this event, and it's a blessing to be asked to do the prayer. I would like just to thank all the leaders who represents this event, Dr. Memwa, Dr. Poon, Dr. Ololei, and also Kennedy Norwood, who has been making communications with me. So can we bow in prayer, please? Heavenly Father, we come before you with grateful hearts as we gather for this year's Maternal and Child Health Education and Outreach Conference. We thank you for the privilege of assembling both in person and virtually with a shared purpose and commitment to the well-being of mothers, children, and families. Your word reminds us in Proverbs chapter 31, verses 8 and 9, to speak up for those who cannot speak for themselves and to defend the rights of the poor and needy. Today, we acknowledge that calling, Father. We acknowledge the sacred responsibility placed before us to advocate, educate, and to serve with compassion and integrity. Father, we thank you for the diversity of voices, experiences, and expertise represented here. Grant us humility to listen well and the unity of spirit as we collaborate and learn. We ask for your guidance over every presentation, over every discussion and decision, Lord. We give wisdom generously. We ask that you will give us wisdom generously and sharpen our understanding and direct our efforts so that what is shared here leads to meaningful and lasting impact. Lord, strengthen those who labor faithfully in this work and remain steadfast with hope and purpose. Above all, we surrender this gathering to you. Let your will be accomplished. May your presence be evident, and may your love be reflected in all that is said and done. Lord God, may the outcomes through this conference extend far beyond today, bringing healing and hope to the communities we serve. In Jesus' name we pray, amen.
Thank you, Janice. All right, we will move into our open remarks. Our open remarks will be given by Dr. Esther Olalier. Dr. Esther Olalier is a professor of pharmacology and a senior associate vice president for research and innovation at Texas Southern University. Her formal training in pharmacology and epidemiology were at Johns Hopkins University School of Medicine and Harvard University. She has expertise in pharmacology and epidemiology research spanning over a combined 23 years, working on research focused on disease that disproportionately affect underrepresented minorities. She is the PI of the $21.5 million NIH-funded Center for Biomedical and Health Research. Dr. Olalier is also the PI and PD of the $2.28 million HRSA-funded MH-REACH, which stands for Gulf Coast Collaborative Center for Maternal Health Research, Education, Advanced Training, Community Engagement, and Health Empowerment. Please welcome Dr. Olalier.
Good morning, everyone. Or we can do better. Good morning, everyone. If we're going to be the ones to solve the maternal mortality and morbidity issues in this state, we have to be awake. So good morning, everyone. Well, today I bring greetings from our president, James Crawford III, and also our provost, Carl Goodman, as well as Dr. Penn Marshall, the Vice President for Research and Innovation. And we feel so blessed to have the opportunity to do this, not only for our community or even Harris County, but more importantly for the state of Texas. Some of you may be aware that the state of Texas has the highest maternal deaths in this country. And we said at Texas Southern University, this is not going to happen under our watch. So give it up for yourselves for all coming here today to address this issue. So why are we here this morning? We're here to really learn and understand and contribute to the discussions. We're here to make recommendations to our policy leaders, our elected officials, because every voice counts as we resolve this. Before I go ahead with my slides, I would like to acknowledge our great staff from CBMHR and MH-REACH. If you're here, just please rise. Please, come on, stand up. Don't be shy. Those are the boots on the ground doing all this work. I would like to especially acknowledge Cecilia Torres, Give it up for Cecilia. I'm so proud of what Cecilia is doing. And of course, I would like to acknowledge Dr. Ajewole. She's the convener of this community engagement outreach. Thank you, Dr. Ajewole. I always remember when you started out in the lab, and I feel so blessed to continue to work with you and really transform our communities in Texas. Thank you for the other leaders, Dr. Poon, I see Dr. Ogbo, and of course, thank you to our sponsors, our partners, and our speakers. We really look forward to a great discussion today. So I'm going to move quickly because my job is just to bring in the money and we get the work done. So I'm going to move quickly. So in terms of our maternal and child health centers that we've had at the university, I'm so proud of what TSU has done to date. We have produced, I believe, over 160 students, postdocs, trainees, interns that have been trained over the years, not just under MHREACH, in maternal and child health. And this has been our framework. We don't do things randomly at TSU. We build structures, we build systems, and we make sure that they're sustainable. And I'm so proud here. We have one of our students that graduated from TSU several years ago and went through our MCH, our first MCH program. She actually leads one of the county agencies, the maternal health department. Lariana, please stand up. Give it up for Lariana. So we're so proud of, I don't know if people realize it, we do not have a school of public health at Texas Southern University. We do not. So we are really making lemons out of lemonade. We've been super blessed, and we're hoping to continue to be great stewards of those blessings. So with the new center that was established in 2023 through funding from HRSA, we've established a new maternal health research center, which we call MHREACH. And to date, I'm so proud of what the faculty, the staff, and students have done. Not only have they analyzed a lot of data, because part of our job as scientists and researchers is to analyze data, but we really get on the ground and work with our community. Please give it up for Kennedy Norwood, our MHREACH CHW, going all to everywhere in this city to make things happen for our communities. And so Kennedy works alongside Dr. Pounds. I believe I'll show that slide later, but I'm so proud of what they've done to date. Just in about 2 years, this center has acquired close to $27.4 million from the government to do maternal health research. Give it up for TSU, especially during this time in our country. That shows the power of the work we're doing at this great university, which were historically Black college and university. So TSU is doing a lot of great work. The federal government, the local government, they recognize this and have entrusted us with funding to keep moving forward. We've also increased. Remember I said we do not have a maternal we do not have a school of public health, okay? We hope to have that someday. I keep reminding Dr. Ajewole, we may just forget about did I say that? I was going to say, forget about all the hospitals. We're going to create our own hospital, get through all the bureaucracy to really move the needle. But I do want to acknowledge that our partners, the county government, the state government, everyone is working hard. But I think one of the opportunities we have is to actually work together, because clearly we're all doing great work, but it's not moving the needle. Our mothers are still dying daily, especially our Black mothers. And if you guys understand that close to 80% of pregnancy-related deaths are actually preventable. Somebody say preventable. So that keeps me up at night, that we are not just doing things randomly. We will make sure we get to the bottom of this. We're sitting next to the largest medical center in the world. Somebody said in the planet or universe, okay? But the point is, this cannot happen under our watch, where Black mothers, other mothers are dying daily. We're next to the largest, and I would like to say the best, medical center. So what are these gaps? What are the social supports? What are the non-medical drivers of health that are really attributing or contributing to this? What are the gaps in our systems? And that's our job, to identify and understand the underlying mechanisms contributing to this. But we're not going to stop at identifying. We're going to work together with our partners, our community to actually address it. And having said that, my job really was to also speak about what is TSU's institutional commitment. We are really blessed to be under leadership right now at TSU that supports research and supports change and transformation in the community. One of our commitments, beyond building infrastructure, beyond hiring staff, is actually Mackenzie Sinclair. Please give it up for Mackenzie. Come on, stand up, Mackenzie. Mackenzie comes from University of Houston to us. She's our first post-bac fellow. She wants to go to PA school, but she reached out to us and said, hey, I want to. She's so passionate. So I won't be surprised if she ends up in the White House, okay? Just remember to take all of us with you. But she's so passionate. You can have your say. So one of the institutional commitments is TSU paid for us to hire post-bac fellows that will move the needle in the community and really improve maternal health outcomes, and several other staff that we have. To date, we've submitted manuscripts. We've trained high schoolers, 29 high schoolers. Please give it up for Dr. Pone and Cecilia. I have to acknowledge these people because something at TSU, which we noticed later on, is when we get funding to do work, we just jump right in and do work, okay? And then we realize a lot of our colleagues or at some other institutions, they have like 100 meetings planning the work, but we just jump in. So these people at CSU have been so productive working with our community partners to do a lot of great work. You hear shortly from, I believe, Dr. Idowu and Cecilia, their work on secondary data analysis, trying to develop a predictive AI ML model to address some of the trends in hypertensive disorders of pregnancy. Our center focuses primarily on hypertensive disorders of pregnancy, which is one of the high causes of deaths among our mothers. Also, you hear from Dr. Ajewale and Dr. Jones on what they've done in building an innovative, comprehensive, and multi-medication therapy management model. Okay, I'll just break that down to simple English. They're creating a really nice, integrated support intervention for our mothers, and we want to test this out. You hear from them, they've completed 13 sessions with people with lived experiences, with healthcare providers, to really hear from them and see how can we really make a change. So please give it up for Jasmine, Dr. Ajewale, and their team for doing that. Also, part of our work is to deploy community-based solutions. And who's the best person to do that? The community. So we roll out several pilot projects for our community. So you hear from Dr. Ajewale, Dr. Ido, you hear from all of them. These are the names of the capacity we've built to date. Now 102 people. Give it up for TSU, I'm telling you. One of the things we've been doing is also providing maternal health care bundles to actually deploy this into our communities. And we have some special things happening soon on a national level. I won't let the cat out of the bag just yet, but we're really excited with that. I believe we've deployed about 297 of those across the greater Houston area and Harris County. I think you heard about we got a recent grant from the National Institute of Health, again, showing recognition for all the great work we've been doing. And this grant is broader beyond maternal and child health. There's 2 major projects focused on breast cancer research, as well as hypertensive disorders in the elderly. This is a great team doing this work. You hear more from Dr. Ajewale on the impacts that we've made over the years. A lot of work has been done. That's the staff responsible for that work. And thank you all for being here. Be patient with us. And I strongly believe that together, those preventable deaths, we will reduce that and hopefully eliminate it in the state of Texas and in Harris County. Thank you. Thank you all. And I would like to bring on the MC, Jasmine. Oh, okay.
Thank you, Dr. Olalier. All right. I will introduce our keynote speaker for today. Our keynote speaker will be Dr. Pamela Behrens. Dr. Behrens received her medical degree from the University of Minnesota and completed her residency in obstetrics and gynecology at the University of Texas Medical School at Houston, where she subsequently joined the faculty. She serves as the Dr. John T. Armstrong Professor and Vice Chair, Clinical Affairs, Department of Obstetric, Gynecology, and Reproductive Science at the McGovern Medical School at UT Health, and the Chief of Service, OBGYN, at the Lyndon B. Johnson General Hospital, Harris Health. She has an active clinical practice and teaches medical students and residents. In her role, she sees mothers referred for clinical consultations with difficult breastfeeding complications. Her academic and educational focus is on pregnancy and postpartum care, breastfeeding, and breastfeeding complications. She is active in Academy of Breastfeeding Medicine and has participated in several research projects on breastfeeding. She is active in outreach, multidisciplinary breastfeeding education across the state of Texas with the Texas Department of State Health Services. She serves as a physician co-leader for the National Institute for Child's Health Quality Texas Breastfeeding Learning Collaborative, encouraging hospitals and providers to incorporate baby-friendly hospital practices. Please give a warm welcome to Dr. Pamela Behrens.
Thank you so much. It's really an honor to be here with y'all today. I'm very grateful for allowing me the time to speak and to kind of lay out some of the concerns we have about where we are with maternal morbidity and mortality, and maybe outline some of the work that we need to do. There's just so many opportunities here, and I have to start by acknowledging the prior comments about the need for research. We really, to be able to fix the problem, we need to understand the problem, and we don't understand it. We don't have the data we need. The information in the registries is just not enough. We need to really understand these actual cases, and it's hard to do that with the current ability to share data and the restrictions. And I understand privacy, but to tackle the problem, we have to know what the problem is. So anyway. The maternal mortality rates are 2 to 4 times higher for Black women than for white, Hispanic, or Asian women. And it actually reaches 50 deaths per 100,000 live births in 2023. You can see there the representation, and thank you to, most of these slides really are thank you to the state of Texas and through the McKinsey and company reports. They just have better visuals, but it really is significantly different. Texas, as she mentioned, is higher. I have to say Harris County is higher, and Southeast Texas, I heard some very frightening numbers from that portion of the state, over 100 for the African American population. Really concerning, and we have so much work to do. So this is kind of a breakdown of the maternal mortality gaps between Black and non-Black women in the United States. You can see there's a significant difference. The blue line, do I have a pointer? Yeah. So that would represent the Black population compared to the other population really from 2018 to 2023. And you can see there's a significant gap. And though the gap kind of has come down compared to 2021, that was really related, I think, to COVID, the higher peak that we had back then. Overall, we really haven't made progress from 2018. We're fairly static. And that's a really frightening thing because we've been working really hard on this. The Texas pregnancy-related mortality ratios, or PRMR, are the pregnancy-related deaths per 100,000 live births. Sorry about that typo. And they refer to a pregnancy-related death as defined as a death of a woman during or within a year of pregnancy that was caused by a pregnancy complication, a chain of events initiated by pregnancy, or the aggravation of an unrelated condition by the physiologic effects of pregnancy. And as she brought up before, hypertension is probably a big one here. The potential ways to get at this really are to stop that chain of events or to intervene earlier in that chain of events. And you can see here the pregnancy-related mortality ratios by rate and ethnicity specific to Texas. Again, looking at kind of over the years and progress. 2023 numbers, or sorry, 2020 numbers here. Oops, sorry, my pointer. 2020 numbers, again, this is for all of Texas, not really progress. And then these are the breakdowns related to Hispanic, non-Hispanic, Black in the golden bars, and our ratio for other ethnicities. So again, higher and maybe a little progress, but certainly overall not really progress in the last decade. Lots of work to do. These are the causes of death reported. Again, this is the state of Texas, specific to the state of Texas. So drugs. Drugs are still a big one. That's the #1 leading cause of death. And again, this is within a year. Cardiac events. Cardiac events are probably in many ways related to hypertension. So just to kind of include that. COVID-19 was a big one. Homicide and suicide are still high numbers here. And those are things that, again, that continuity of care and earlier intervention can be helpful for. We've worked hard on this with screening for depression across the state. I think we've gotten a lot better about screening for both hypertension and substance abuse early in pregnancy and on hospital presentation, at least across the state. We've worked hard on those initiatives. But again, still an opportunity. This is actually looking at the enhanced maternal mortality ratios within 42 days. So this is a shorter look. And they did exclude car wrecks. That's the MVA, motor vehicular accident, just since that's a little harder to get at. But again, looking at the mortality rate really in that first month and a half after delivery. And again, we still have a lot of work to do. You can see essentially this number is still higher than this number a decade plus later. So again, concerning to me with all the work that we're doing that we're not getting there. All right, now I'm going to talk about some specifics. So this is really specific to hypertension. So again, the non-Hispanic Black is the high line here for hypertension. The black line is the overall for the state of Texas. So our hypertensive rates seem to be increasing. Some of this is likely related to obesity. I can't tell you that for sure, but our population is becoming more obese. It's interesting to me that hypertension has gone up significantly, really, in the last decade. So again, I can't change that hypertension. I don't have the ability to do that, but I can intervene earlier. We can catch these women with hypertension in the first trimester and get them into care and get them into monitoring and teach them how to use blood pressure cuffs. I shouldn't be teaching women how to use blood pressure cuffs when I'm discharging them from the hospital. That's a little late, right? We need to do this in the first trimester. We need to get women into prenatal care quickly, and we need to get them taught as to how to do this. And ideally, we need to teach all pregnant women how to do this, right? All pregnant women. This is diabetes. The diabetes rate is a little bit higher for our Hispanic population. The overall bar for Texas, again, is here. Non-Hispanic other, that is going to be Indian, American Indian, and other groups. The Black population does not have the higher incidence of diabetes. I work at LBJ predominantly, and LBJ is probably about 90% Hispanic. So to me, everybody has diabetes until they're proven otherwise. But that's just because of the population that I'm caring for and that high rate of diabetes. Again, diabetes has other repercussions for the mother and the baby. More likely that the baby is going to end up a little bit too big. It's going to have trouble with low glucose at birth. It's going to go to the high-risk nursery if its glucose is too low. So these have other impacts to the pregnancy. And again, early prenatal care can help with this. If we control the diabetes early in pregnancy, if we test these women in the first trimester and get them started on programs for healthy nutrition and exercise and activity, other lifestyle changes, and try to work on some of these social determinants of health, we can impact not whether or not she's got diabetes, but the result from the diabetes. So this is what I was commenting about before about why are these numbers increasing. And again, I'm just speculating, but I do have data to tell you that obesity in pregnancy has increased pretty dramatically. So you can see there that 27.8% of all mothers with pre-pregnancy obesity also had hypertension, diabetes, or both. And if you look at women with a normal pre-pregnancy BMI, it's only 10%. So those risks are more than doubled by her having obesity. And we really have an epidemic of obesity in our population. So I think, again, this is education that we can do on the pre-pregnancy side, right? I know nobody likes to tell anyone, I happen to say fluffy. Nobody likes to tell anyone that they're fluffy. But they need to know that if they're planning a pregnancy, being fluffy can have some adverse implications to that pregnancy. So again, this is pre-pregnancy obesity by rate and ethnicity specific to Texas. And you can see, again, that the non-Hispanic Black women have the highest incidence of pre-pregnancy obesity in Texas compared to the overall Black line for Texas. We, again, need to keep working on this. The Hispanic population is also above the average line. So both populations with diabetes and hypertension are more common in the Black and Hispanic population. So I know that I'm supposed to talk about maternal morbidity and mortality, but I have to throw in some infant data here for us too. So the percentage of infants born preterm by rate and ethnicity for Texas, again, across the last decade. And you can see here our non-Hispanic Black mothers are well above the Texas average. I'm not saying that this is all spontaneous preterm birth. Much of this is our fault as the doctors. It is iatrogenic preterm birth because I have to deliver her early because her hypertensive disorder is so bad that leaving her pregnant puts her at risk. So I have to balance the risk of the infant being premature with the risk to the mother of leaving her pregnant. That is a really tough balance to do, right? How sick do we let mom get before we make the baby be born preterm? So they really are very closely related. It would be easy if I could just keep treating her hypertension and let that baby get to term, but I can't always do that. So just to kind of understand that tie-in. Infant mortality, again, for the state of Texas relative to the US, and unfortunately, the state of Texas has a higher infant mortality in the first year of life compared to the overall US data. So this is, again, a breakdown of the infant mortality rate for the state of Texas, again, with that kind of big gap between the non-Hispanic Black population and the overall state of Texas number. So about a 5 percentage point gap there, pretty significant. I can't do a talk without having breastfeeding. I'm sorry. I know that again is a little tangential, but I can't in my heart do it because breastfeeding affects health for both mothers and babies. And that message we've worked really hard to get out there. It's not all about the baby. Yes, it's the best nutrition for the baby, but it has later life implications for the mother's health related to breast cancer and ovarian cancer and hypertension, heart disease. All these other metabolic conditions really are influenced later in life by how you fed your baby. And again, we need to keep working on that message. So in this slide, the numbers are the opposite, right? We want a lot of breastfeeding, and you can see that the numbers remain a little bit lower for our Black population than for our Hispanic and non-Hispanic white population. So to get back to my earlier comment, early prenatal care. So early prenatal care in Texas, again, there seems to be a difference based on ethnicity and access to care. So again, the black line is the average for the state of Texas. More is better. We want early prenatal care, and the purple line for the non-Hispanic Black population is lower. So our community can do better. And some of this is logistics. The paperwork to get on these programs is not easy. It would drive me insane, right? So we need to make getting early prenatal care easy. We can work on the paperwork later, but if she's got a positive pregnancy test in the state of Texas as a public health initiative, why can't we get her into prenatal care? We can do the paperwork later, okay? Postpartum care, another place, I think these numbers are much higher than the numbers I see. I don't even think I have 50% for postnatal care. It really is a struggle. But if we improve our postnatal care and we see women earlier and more often, we can do a better job of supporting them with managing their hypertension that we diagnosed during their delivery. Hopefully during their prenatal care, but sometimes we haven't met them till their delivery. So you can see here, this is the average for the postpartum care in the state of Texas, and this is any visit within 12 weeks from delivery. So, and again, there's a difference, a slight difference in the non-Hispanic Black population. But I can tell you in my population at the county, I think it's significantly lower. We have structurally tried to make changes to this. ACOG, maybe 5 years ago, made a recommendation that in addition to the 6-week visit, we see women back at a 3-week visit, okay? And that 3-week visit, we're working to make it easier for moms. A lot of that can be done telehealth, right? We can talk to you and we can screen you for depression. We can do that over the phone. We can see how the breastfeeding's going, and if you are having troubles, refer you to WIC or lactation. We have the Lactation Foundation here in the city that will give you sliding scale assistance, and it's, again, jointly sponsored by UT and WIC. It's a great resource, and it is specific to breastfeeding. We can talk to you about contraception. Many of those we could send in, but not all of them. Some of them you have to come in person to kind of deal with that, so we can have better childbirth spacing, right? We know that having a short interpregnancy interval is more likely to result in preterm birth. So we need to counsel women about that and get you on effective contraception to avoid that, right? And then manage those diseases that we've diagnosed either during pregnancy or delivery, like hypertension, diabetes, obesity. Okay? So much work we can do. Again, I have to throw this slide in there for my dear friend, Dr. Stafford, but Texas is the highest rate of congenital syphilis. We're just, and again, if we touch a woman who's pregnant for care at any point in time, be it in an emergency room, be it in a prenatal care visit, we need to look at this. We need to treat this and stop it from harming our babies because it wasn't diagnosed and treated, okay? So it is not good to be known around the nation as, oh, you're from Texas. Yeah, that's where the syphilis is. Not a good thing. So closing this gap, and again, this is from the McKinsey Institute about things we can do to close the gap in Black maternal health care. And there are just so many things we can do. But from their report, just to kind of touch on them, count women by standardized maternal health metrics, improving the race and ethnicity disaggregated data collection. And I would say we have to improve our death registries. I have worked with the death registry mostly on the baby side, right? But nonetheless, it's terrible. You can't enter accurate information. The program is just not adequate. To tackle the problem, we have to know what the problem is. We have to share data, and we have to have good data. You know, the garbage in, garbage out. So true, right? So we need that research, and thank you for doing that research, okay? Study women by increasing Black representation in these research projects and increasing, just in general, pregnancy and breastfeeding in the research that's funded by the government, right? Care for women by expanding comprehensive postpartum health care and improving provider participation in Medicaid and health plans, absolutely. Include women by embedding culturally responsive care practices, give the providers the tools, these home kits, awesome. Great work with the home kits for blood pressure monitoring. Awesome. And invest in women by increasing capital for maternal health innovation, 100%. So some specifics, closing the insurance gap coverage. Medicaid covers up to 133% of poverty level. Not enough, not enough. Providing immediate coverage, I mentioned this already, right? She's pregnant, why is there a delay from the financial aspect? Shouldn't be a delay. We should provide care the second that she knows she's pregnant. Increase the provider enrollment, expand telehealth services, especially in our maternity deserts. And we have plenty of maternity deserts across Texas, plenty of them. Decreasing administrative burden. Again, it shouldn't be that hard. It shouldn't be that hard. Reducing and treating chronic diseases and addressing social determinants of health, food insecurity, childcare, and transportation. And I know many of you out there are working on these things. We're doing things like having prenatal visits go to you with buses and things like that across the city. We're working on addressing food education and programs to provide food outreach. I'm really lucky at LBJ that we have a food pharmacy. That is just really an amazing feature to be able to offer that and to offer some of the programs that we have with food as medicine for our pregnant women. And we're doing research on that. Really appreciate it. And then improving health literacy. Again, educate her early in pregnancy about what's going on, and this is really something the community can be hugely active in. And I just wanted to show some famous cases just to remind you of how much work we have left to do. We just should not have tragedies like this still. And I know that as an obstetrician, I can't fix everything. But like she said, 80% are potentially preventable. So I can work on that 80%. I can't fix the really terrible, horrible things that sometimes happen with car wrecks and things like that. But we can do a better job on many of our maternal deaths. We really can. So thank you again. It was such an honor for y'all to invite me to speak.
Thank you, Dr. Behrens. Please give it up for Dr. Behrens. All right, so we'll be moving into our first panel session. Just for the audience information, so for this session, each panelist will give a 5-minute presentation on resources available through their program. And for the panelists, I will read the bio of the first panelist. They'll give their presentation. Once you finish your presentation, you'll go back to your seat, and then we'll continue until we finish all the panelists. Once I finish reading the bio of the moderator, you can come up to the stage. All right, so our first panelist is Ramatu Manzare. Ramatu Manzare is the Deputy Assistant Director and Director of Nursing at Houston Health Department. An accomplished public health nurse, Mrs. Manzare brings extensive experience in clinical practice, program management, and public health operations. Her background spans women's health, case management, and care coordination. She holds a Postmaster of Science in Nursing Education from UT Health Houston and a Master's of Science in Nursing with a public health focus from UT Austin, a Bachelor's of Science in Clinical Laboratory Science from UTMB Galveston, and a Bachelor's of Science in Biology and Chemistry from Sam Houston State University. Mrs. Manzare currently leads maternal and child health initiatives, championing equitable care for mothers and infants across Houston. Please give it up for Mrs. Manzare.
Good morning. Thank you. All right. Thank you for the introduction, and thank you for having us here again, representing the Houston Health Department. What you guys are seeing up there, because I have 5 minutes, is a slide that was created by our epidemiology team. The Houston Health Department has taken a stance over the last couple of years, in part because of partnerships with TSU and other organizations working to address maternal child health, to really focus and address what resources we have and how we can pull them together. And so we did an inventory to identify what areas touched maternal child health. And so in the big circle are major programs that you guys are probably may all be familiar with. We have our WIC program. Of course, most of you are familiar with that. We currently have about 14 sites across the city providing services and resources to clients. We have our Nurse Family Partnership Program. Houston Health Department has 2 sites. Nurse Family Partnership Program is a program that supports first-time moms, and they get partnered with a registered nurse throughout their pregnancy until the infant is 2 years old. And they provide support with clinical services, as well as any connections or social services that they might be able to need to support the client throughout their time. And then there are other sites here in Houston that also have nurse family partnership programs, and that's with Baylor Teen Clinic and Texas Children as well. We have our Healthy Family Houston, which is a program that some of you might be familiar with here in town that supports clients that really with the goal of trying to address any risk of child abuse, co-parenting, and providing some of those resources. And that's really focused on with our community health workers and trying to address some of those challenges that clients might have in that space. And then we have our family planning and reproductive health team. And those are through our health centers. And that is where a client might be in need of family planning, contraceptives, reproductive coaching, caring, considerations and communications. And they also provide some services and resources to clients within the community that come to see us. So those are our primary programs that we have. Our secondary programs are the ones that you see around that touch clients within this maternal child health space, right? We have our perinatal hepatitis B prevention program. We have our immunization program that addresses that age group. And then, of course, we have chronic disease. As already mentioned by Dr. Behrens, we want to be able to address, hypertension, diabetes, all those things, because we know that before childbirth, that health also matters as well. And then after the baby's here, that health matters as well. So we have our chronic disease. Our C to Succeed, providing glasses for our kiddos, young kids. Oral health. We also have our dental team that also provides services to the clients while they're pregnant, as well as the little ones. a community health, a community and environmental health team, and our adolescent health and violence prevention team. They're also working with that age group and within that childbearing group to provide services and resources such as lead and asthma testing for the parents and for the kiddos. And of course, we have our HIV, STD, syphilis group and general surveillance team looking for VPDs and any communicable diseases. And so overall, we're providing resources to our clients as a whole. And really the department's goal is to try to ensure that all of those programs are connected and really working together to make sure that we have those resources available for you. And so these are our main programs that I mentioned. We have Healthy Family contact information for our Healthy Families Houston and our Nurse Family Partnership Program. Of course, you can always reach out to me directly if you need any additional information about any of the other programs that I mentioned. That's all I have. Look at that. Oh, here, bye. Thank you.
All right, so our next panelist is Loriana Bernaldo. Loriana Bernaldo is a maternal and child health program manager at Harris County Public Health and doctoral candidate at the University of Texas Health Science Center School of Public Health. Loriana's focus on maternal and child health began after receiving her Bachelor's of Science in Biology degree from Xavier University of Louisiana, and following graduation, she was offered a research opportunity at Texas Southern University in collaboration with Baylor College of Medicine, Maternal and Child Health Student Training for Academic Readiness and Success program. She also completed her Master's of Public Health and Epidemiology degree with highest honors and a certificate in maternal and child health. Currently, Loriana sits on the City Match Board as the youngest board member of a national organization of urban maternal and child health leaders. Please welcome up Loriana.
Hi, everyone. Dr. O, I think you're somewhere in the room. I just want to acknowledge you because you've seen me since I was an undergrad student, to a master's student, to a doctoral student, to an intern, to a fellow, and you've watched my journey, and you've guided me along the way, every single step of the way, and you've always been one phone call away. So I just want to send my thanks and my honor to you. So as Dr. Jones said, I am Loriana Bernardo. I am the Maternal and Child Health Program Manager at Harris County Public Health. We were established in 2021, and it was because of the maternal mortality rates in Harris County. I don't have to go through the statistics. If you're sitting in this room, more than likely you already know what's going on in our county and in our state. And so our number one priority when I stepped into this role was to empower mothers and birthing persons across the county so that they can reach a level of self-sufficiency to raise up that baby. Or if they were not a first-time mom, how can we empower the families as a whole and the entire household to build them up? And so first I want to acknowledge my team in the back, the Maternal and Child Health Program. They are here on site. So I'm so proud. I wouldn't be able to be on this stage today if it wasn't for them. And so we are a home visitation program, and I'll kind of go through some of the services that we provide. So at Harris County Public Health, we have taken a public health approach to maternal and child health. And when I first started, I was the first maternal and child health program manager. We were the first maternal and child health program for the county at the county level. And since then, of course, like we have Texas WIC, which is for our families, but we also built like an Access Black Maternal Health program. We built a maternal mental health program, and we also were awarded the HRSA grant for Healthy Start. And so our priorities around maternal and child health has been since the maternal and child health program started. And it was a focusing on reaching mothers and families that were in need, that needed the most help, that were vulnerable, but then also to make sure that we can provide those public health services, we can bring them to the communities that we serve, and we don't exclude anyone. And I'll go through kind of how we came about our strategic plan for the maternal and child health program. So our program approach, the services that we provide, we are a home visitation program, and we provide support to the entire household. As the saying goes, it takes a village to raise a child. So if we can uplift everyone in that household, they can be uplifting to the mom who is healing from birth, who is tired, who's restless, because she needs healing power as well. And so if there are other family members, if there's other children in the household, we also provide our services to them as well. Parent-child relationship building, assistance and referrals to support services. The beauty in that is that we have over 200 partners now since we started the maternal and child program that we can refer services to, even to the point where one of our top partners, which is Star of Hope, that provides housing, temporary housing to our families that are experiencing homelessness, I can call them at 2 in the morning and they'll say, bring them over right now. And so we've seen how the program has changed lives. We've seen how partnerships have changed lives. And since this program started, I've always said that we cannot continue to work in silos if we want to move the needle. I understand that funding is limited, but if everyone does not get on the same page in Harris County, we will never see the data improve. And that's our number one priority, especially for our Black moms and our Black families. And so also lactation education and in-home support. We have the honor of having our own lactation consultant that does home visits, that does FaceTime calls, that takes emergency calls over the weekends, holidays, whenever the mom is experiencing any challenges with breastfeeding. We also have our new car seat distribution and safety initiative. So if you are enrolled in our program and you enrolled during at least at the second trimester, you will get a car seat. And they were a pretty penny, but I had money. So there are 4-in-1 Graco car seats that we provide, but then also they go through a class. We have a partnership with the fire department where they go and get trained on how to install the car seat and receive education. This is a typo. We also, I see Ms. Veronica actually in the audience. We have a partnership. We are a recipient of the American Heart Association MomRx program. So our participants receive in-home monitoring for their blood pressure so that we can try to get it controlled. So as Dr. Barron said, that we want to get that controlled, especially during the first trimester. We want to make sure that they are engaging in prenatal care during the first trimester. Ideally, of course, if it's a planned pregnancy, we would like to make sure that they are engaging in reproductive care prior to pregnancy. But we also understand that there are not so ideal circumstances. So wherever you are in that process, we will make sure that we guide you along your journey. Safe Sleep initiative that we have with Texas Children. So we provide pack and plays to our families to make sure that their babies are in a safe sleep environment. And then distribution of mother and baby items. We understand in this current economy that things are expensive. So we provide diapers, wipes, formula, all kinds of baby items. And it's really to encourage them to keep on with their visits, to keep on going to their prenatal care visits, to their well baby visits, to make sure that we can provide the things that they should not have to focus on or put their money into, because we know that they have other priorities that they need to put their money to. And so last but not least, we strategically put our target population and eligibility together, and it was to decrease the barriers to care. So we only have 2 requirements for our program, and it's that you are a Harris County resident. Harris County is huge. We're the 3rd largest county in the US, and we're the largest county in Texas. So, and then secondly, you are currently pregnant, you recently delivered in the last 12 months, or experienced a pregnancy loss in the last 12 months. And that last point is so important to us as we build our maternal mental health program. When moms experience loss, they don't realize that they still matter. A lot of them don't realize that they still qualify for WIC services. They still qualify for all kinds of services that are there. And we want to make sure that we support them and guide them. And we also have incentives for them too, because we know that that's a sentimental moment in their lives where they experience a loss and then they have to go home. They've probably had their baby shower already. They've taken their photos. And so we want to make sure that we are very sensitive to their situations. And so our table is in the back, as I said. I have my business cards if anyone would like to reach out to me. And I want to thank TSU so much for allowing me to come and speak about our program. Thank you.
Thank you so much, Loriana. All right, so our next panelist is Heather Busher. Heather began her social work career in 2007 as a foster care adoption coordinator at the Arms Wide Open. In 2010, Heather started their DSHS-funded parent education program servicing families in Corpus Christi and Coastal Bend area. Following that, she served as an elementary school social worker in Corpus Christi ISD. In 2012, Heather transitioned from direct services to macro social worker, serving as a maternal and child health director in the Gulf Coast March of Dimes for 10 years. In 2023, Heather moved to the American Heart Association, where she currently serves as a vice president of health strategies for the Greater Houston region at the American Heart Association. There, Heather leads the community impact team in implementing 100 years of heart health research and programming throughout the Greater Houston area. Please give it up for Heather.
Thank you so much, and thank you all for having us today. TSU, I have to commend you for this collaborative opportunity that we have. I just want to say that I very much appreciate in the maternal and child health world the true collaboration that we see across so many cross sectors of what we're trying to address: cardiovascular health, congenital heart defects, diseases, all kinds of things. So I appreciate the opportunity for us to be here today. As you know, and we saw some of these details, this is a U.S. statistics that cardiovascular disease death rates per 100,000 people skyrocketed in 2021, and this is overall, and we're still working to bring that number back down, and that number coincides with what we're seeing in pregnancy as well, unfortunately. Overall, we are really trying to drive equitable health, and as American Heart Association, we do this in a variety of ways. We're looking at tobacco cessation. Many of you know us from CPR education, and we're including infant CPR in the work that we're doing with our maternal health now. We're looking at a Go Red for Women umbrella, and that's what our maternal health falls under, and then our blood pressure work. So we're taking this lovely, colorful circle and trying to fit everything into maternal health, because you all know so much of a woman's life and what's going on around her impacts that birth and the outcomes of that birth. Our priorities in Houston, really quickly, like I mentioned, are improving blood pressure, increasing nutrition security, and reducing risks for women. And so again, we're trying to fit this all into maternal health and how we're working with our partners across the community to address better birth outcomes for mothers and babies. So we're really excited. What we've done over the last year or two since I was here last was we have kicked off our MomRx program. So the last time we were here, we were just looking at, we had come out of a year's worth of what we called maternal health roundtables. So what we were trying to do was really find our place in cardiovascular maternal health. So I say that because there's wonderful organizations like the March of Dimes and the Preeclampsia Foundation. So we brought together the groups that we were already working with. Veronica is here, like Lariana had mentioned, who was leading our clinical programs and community work as well. And so what could we do with those partners we were already working with to bring in the maternal services that they were already doing and bring in cardiovascular health? So last year we launched the MomRx program in February. That includes, like I mentioned before, many of those areas of what we're trying to determine. So MomRx is a lovely program that provides blood pressure monitors, number one, to pregnant women, hopefully early in their pregnancy, as early on as our partners can get to them, to help improve that blood pressure. There's a nutrition security portion of it as well, where we're giving out food boxes, we're doing nutrition education and meeting those clinics and community partners where they are, some of which are in the room, and so we wanna make sure we introduce you to those. And then giving them infant CPR kits and teaching the moms as well, or family members, hands-only CPR is a huge part of that. So our Mom RX program, we're a year in, we're just starting to get that data. I think that's really important. Like Dr. Barron said, maternal health data is so hard to get. And so Veronica worked with the University of Houston College of Medicine to create a data set of questions that we're still trying to hone in on and work on. What are the best questions that we can ask the implementation sites to make sure we are meeting the moms where they are, that they're learning how to check their blood pressure, that self-monitored blood pressure program, that they're learning how to cook better and maybe prevent diabetes, not only for themselves, but their family in the future. If they do have gestational diabetes, meeting them where they are and improving their health education and nutrition education. And then just overall reducing their risks and really looking at that fourth trimester education as well. So we're really trying to hone in all of those things with the MomRx program. I want to thank the sites that have been on this journey with us. So as Lariana mentioned, we have Harris County, City of Houston, Spring Branch is in the room, Legacy is in the room and does a version of this program with us as well, along with other sites, the University of Houston Family Care Center, and their CHW system. And we're really excited to announce that we're now recruiting for cohort 2 of that program as well. So if you're interested in joining this journey with us of how we can better address cardiovascular maternal health within the greater Houston community, grab myself, grab Veronica. We really want to bring in more sites to help us better understand how to get those blood pressure monitors to our moms and their families and make sure they're checking their blood pressure correctly and identifying those high readings early on so that we can get them the proper medical care. I'm really excited as well as an organization just talking about low-dose aspirin more and those kind of things. So thank you for this opportunity and more to come, and please join us.
Thank you, Heather. All right, we'll move into our last panelist for this session. So we have Alejandra Zuniga. Alejandra Zuniga is a director of perinatal navigation at Legacy Community Health, where she provides strategic, operational, and clinical leadership of Legacy's obstetric services across the continuum of care in partnership with the medical directors for the OBGYN and pediatric service lines. She leads interdisciplinary teams to deliver patient-centered, evidence-based care and improve maternal and infant health outcomes. Alejandra's work includes implementing quality improvement strategies to reduce maternal morbidity and mortality and leveraging data-driven insights to optimize care delivery. Alejandra has successfully developed and extended innovative programs, including Legacy's walk-in pregnancy test dashboard, Legacy's Becoming a Mom program, Delphina Care, the Peripartum Pediatric Navigation Program, and the Peripartum Navigation Program. Please give it up for Alejandra.
Thank you. It is an honor to be here. My name is Alejandra. I'm a director of prenatal navigation at Legacy Community Health. Legacy is a federally qualified health center. We are actually the FQHC that sees the largest OB volume in the nation. And so this is a great and dear program, and the support that we provide to our moms is essential. And I'm happy to be here today to tell you a little bit more about the work that we do. Legacy's perinatal navigation program has a lot to offer, and so it was difficult to compress it all into 5 minutes, and so I'm going to do my very best to explain. But it is a program that is focused on providing patient-centered care, and we provide pregnancy testing, education, navigation, and our goal is to provide that support early on, starting from preconception all the way until mom has delivered, and also early childhood as well. And so our goal is to increase early access to prenatal and preventative services, and to also be able to strengthen that maternal and family health through education and coordination. We want to address some of all of the things that we have been talking about today, and overall to enhance that continuity, retention, and long-term patient engagement. For the work that we do for perinatal navigation, the 3 pillars of impact are that unique approach that we take at Legacy. And so the first pillar is testing and linkage. And so we provide free walk-in pregnancy testing services at multiple of our locations. When we provide those pregnancy tests, we're not just offering the test, giving them the result, and saying, good luck to you. We schedule that mom to be able to start her care early on. We connect them to our eligibility department that helps them navigate through that process for receiving coverage, and as well as scheduling their appointment for them to start their prenatal care. And we also enroll them at that time into a couple of our programs at Legacy, one of them being the perinatal navigation program, and another one is a program called Delphina, in which provides just also support throughout the appointments for patients. The second pillar is programming. We have an amazing program called Becoming a Mom. So my team is not able to be here today because we actually have a baby shower. So we offer prenatal education. It's a March of Dimes curriculum, and those moms that continue to complete the classes are celebrated through a baby shower. And so today we have one of our baby showers. The other programs, some of our other programs that we have, for example, Food RX is in collaboration with the Houston Food Bank, and that helps to address some of those other social drivers of needs that patients have. And we also have hypertension education. The last pillar is navigation and retention. And so our goal is to be able to support that mom throughout the delivery, and once that patient delivers, to be able to provide that coordination of care for the mom to come back for her postpartum care, and for the baby to come back for newborn care. And so from the moment that a pregnancy is confirmed all the way until the baby is born, our team is there to support mom every step of the way. Our goal is to provide support through the entire maternal health continuum. And so I talked a little bit about our entry to care and the support that we provide there. But in addition to that, while the patient is pregnant, our perinatal navigation program has dedicated navigators that will follow up with the patient throughout the remainder of her pregnancy to make sure that she continues to receive care. Some of the other support that we provide while they're pregnant, I mentioned our Delphina program partnership. And so through that partnership, any patient that needs a blood pressure or blood glucose monitor, Delphina will provide that to the patient in addition to supplies, as well at no cost. And so we know that is one of the barriers that is very predominant in our patients. And then I also mentioned our Food RX program and our Becoming a Mom program. And so our goal is to truly help that mom feel supported every step of the way. And we don't stop there. Once the mom has her baby, we also provide just pediatric support and as well. And so we have a partnership with the state through our Safe Riders program. So we are actually one of the largest Safe Rider program sites. And so we provide monthly car seat classes. Those are open to community members and to Legacy patients. And so patients are eligible to receive our car seat if they complete the class. And we have an amazing program that also provides support for early childhood screening and linkage to early childhood intervention. And so the goal is simple, to make sure that moms have the support, the education, and the care that they need, to be able to have a healthy pregnancy and to also have a good start for her baby. And so Legacy has been doing this work for a very long time, and so I'm honored to be here. We are committed to health equity with programs that are designed to truly meet moms truly where they are. It truly makes a difference to have someone to be able to directly contact in case they need any assistance. We know that the healthcare field is not easy to navigate, and so our moms truly do support that. And it's an honor to see that our patient volume continues to increase, our programs continue to expand, and so legacy continues to grow. And I think that's a true honor to be in the community and to be able to support all of our patients, regardless of what their background is. And so it is a true honor to be here, and I look forward to collaborating with many more partners to be able to truly address some of these maternal mortality rates and truly, have a forefront, to be able to make a true impact for our moms. So thank you.
Thank you, Alejandra. All right, so I'll announce our moderator. So our moderator is Charlie King. Dr. Charlie King is a proud Texas Southern University alumna and graduate of the MCH STAR program in partnership with Baylor College of Medicine. She has been recognized by the Texas House of Representatives, the Houston Black American Democrats, and multiple media outlets, including the Defender magazine, for her leadership in maternal and child health. While at TSU, she helped design the university's first student lactation room, and she is the author of several works, including The Breastfeeding Blueprint. She is also the owner of Mommy Sweet Treats and Company, a lactation health brand, and the founder of the nonprofit The Mommy Room Lactation Suites, where she creates and designs breastfeeding rooms and workspaces in universities to support mothers and family. Dr. King is currently pursuing her Master's of Legal Studies at Texas A&M School of Law, specializing in health policy and patient and patent law. Please welcome Dr. Charlie King to the stage, as well as all other panelists.
Thank you, Dr. Jasmine. Last time you weren't a doctor when I seen you, so congratulations. As we welcome the panelists up to the stage, I just want to say thank you to TSU. This is my second year moderating, so I'm definitely excited to talk about this particular component of the program, which is the resources for maternal child health. So ladies, thank you. Thank you, Heather. I remember you from last year. So I just want to jump into this because in our fields, we do come in contact with patients and with families who have no idea that there are resources for maternal child health. If they do want resources, they don't know where to go. So this is definitely an important part of the program. So Lariana, I'm going to start with you. So with your work, again, I know you come in contact with clients all the time that have no idea even when to start looking for resources. So when do families need to start looking for resources? I believe everyone has to cut through. Yes.
Can y'all hear me? All right, there we go. There we go. So ideally, as I talked about earlier when Dr. Barron said, if you're of reproductive age, you need to start looking for resources regardless of where you are in your journey. That's the best advice that I can give. Now, from a programmatic perspective, of course, as you enter into that, that first trimester, once you get that confirmed pregnancy, we want you to reach out to us to see what your offerings are as far as services are concerned. But I don't think that people realize how beneficial 311 is as well. So 311 has a service directory that is specific for maternal and child health. We are listed on that directory. And they can kind of guide you based on where you live at in the county, the resources that you're looking for. But as far as our program is concerned, we will hold your hand the entire way and do it for you, because we need you to focus on what does that delivery look like? What does postpartum look like? So as far as the resources are concerned, we can do that for you. We can guide you. We have a fantastic team of 26. We're so blessed to have 20 CHCs, or essentially CHWs, on our team. So we are able to provide services to a large population that we serve. And so ideally, as I said, reach out to us as soon as possible. And then also, as far as our lactation consultant is concerned, a lot of people think that lactation comes into play after you deliver the baby. No, we need to start planning as soon as you get pregnant, because your ideal, realistic expectations of lactation may change just as much as your birth plan may change as well. And so we also have into play the Maternal Health Bill of Rights at Harris County Public Health, where we empower families to know what their rights are. And the best advice I give people is, when they reach out for resources, remember that you can fire anyone on your medical team. And I say that with so much love. I say that with so much love. You can fire and hire as much as you desire. And so that's the advice that I have, especially for our women that are of reproductive age.
Thank you. So Alejandra, I'll go to you next. So at Legacy Community, once you guys, interact with the patients and they qualify for services, how receptive are they about actually coming back and get the services and the resources that they qualify for?
I think we are very because we are instilled in the community, and we have done a very great job about just promoting what legacy is. I can say myself, I'm a young mom, and I wish that I would have known all of the programs and all of the things that legacy offered, because I became a mother at a young age, and I had no idea that legacy even existed, and that anybody, regardless of their income, can be seen at legacy. And so I think that that is one of the benefits of a federally qualified health center, that regardless of income, we believe that healthcare is a right, not a privilege. And so because we have been we've done a great job about promoting the things that Legacy does. When we talk to our moms, even though at first sometimes they may be receptive, once they start receiving the benefits, and a lot of the times I think that one of the things that when we consider when it comes to outreach to moms, we're like, how much is too much, right? We don't want to contact them too much, because we don't want to seem too needy or too pushy. But on the contrary, once moms realize the support that we provide and that navigation, they actually are become very well receptive, and so they have no problem with us contacting them. Having somebody dedicated to help them navigate through the system is very extremely beneficial to them, and so they see that as as a not a barrier, right, but as support that they need. And a lot of the times, when some of the team members, maybe they are too busy and maybe they won't call, the mom, or they won't outreach, at the usual time that they do. Then moms will call and like, hey, I was waiting for your call. I was waiting for the touch point that and I think that connecting our moms every step of the way through the resources that we have makes a huge impact as well. We've also seen that for the moms that have previous previous experiences with maybe not being not have the support, right? A lot of the moms that we see truly don't know what this process is, and like I mentioned earlier, our healthcare is not easy to navigate. And so we have seen that at first, maybe sometimes, if they don't know about legacy and they don't know about the support that we provide, they may be hesitant, but along the way, they become very receptive. And so we've seen that, with the additional support and, the frequent touch points and having somebody to directly call, it makes it a huge difference, for our moms. And a lot of the times they're the ones outreaching to us, and, they they look for, not only coming to their appointments, but to the additional support that they will receive in between the appointments, because I think that's one of the biggest gaps that we have. We know that, and our OBs are doing amazing work, but the time is limited in the clinic. And so that support that we provide, outside of the appointment is beneficial, and we've seen that they're very receptive. And then we have the moms telling their friends and their cousins about, like, oh, our Becoming a Mom program, our baby showers, our car seat classes. And so that also helps, to spread the word, and that's how we get, even more, more patients to come and be a part of what we do.
Thank you for that. Now, I had no idea it was so many resources out here, but if I were to think of a source, I would think of Harris County Public Health, but not American Heart Association. That really blew my mind that there's a maternal health component. So congratulations on the launch of Mom RX. Can you just quickly tell me what are some of the goals that the company is hoping happens for this program? You said it's launched in February, so that's very exciting. So again, congratulations.
Yes, so we're a year in, and so really, really grateful to all of these organizations that I'm sharing the stage with, because you all have embraced us as we're finding our space in maternal child health, and we're still doing that. And so we just really want to make sure that we are working as a collaborative with these organizations that are here today. We have so much information on blood pressure and what we can be doing. And so our team that we have here, Veronica Sanchez, who's here today, Kanisha Keener, who's new to our team, and Emily Gordon, that team is really looking for additional partners. Let's learn from you all where our space is, but then let's also take the information that we already have and that wealth of knowledge around blood pressure, identifying it early, treating it. That's all relative to both your primary care and then your maternal care as well. One of the things I really impressed on the team when I got here 3 years ago is that a lot of times maternal care is your gateway to entry. This is the first time a lot of moms have healthcare, good healthcare. And so this is such an opportune time for us to make sure they're looking at their heart health as part of that. You're going to hear from us in the future a lot about what we're calling cardiovascular kidney metabolic health as well. CKM is the easier way to say that. So from now on, I will say that. But CKM is looking at that whole health. It's your diabetes, how it affects your kidneys and other organs, that once you have a heart problem or diabetes, how is that? And again, pregnancy is an opportune time to start taking a look at those chronic diseases that could already be taking over that system. And so our hope is just to continue to engage with you all, learn more from you, how we can better meet the needs of the communities that you all are serving. And most of all, number one, bring blood pressure monitors to moms before, during, and after pregnancy so they know their numbers.
Thank you. So one more question for Ramatu. Did I pronounce that correctly? Okay, so how is the health department going out into the community and making sure they're spreading the word about the services that you guys provide?
So we actually have several avenues. A lot of it is outreach, to where the individual programs that I mentioned are doing outreach within the communities. And then, of course, we also have referrals from clients that we have served as well. And then we also utilize our internal system because, like I mentioned, we have our dental services, our family planning services within our clinics, our immunizations, to work with internal referrals as well, kind of treating them as a captive audience. We have them in our system already. What additional resources and services do they need? And do they include additional maternal child health services? And so we try to link in with those clients there through the avenue as well.
Great, thank you. So this is going to be a question for all four of you, real quick question. From your organization, what is one thing you would like the community to know or possibly spread about your community and what it does for maternal child health? Lariana, we'll start with you.
So one thing that we had to fight very early on in our program is the political stigma around maternal and child health, and then also just being a county program. So I will tell you that we do not ask or look at your immigration status. We do not ask questions as it involves your family or anyone in your household. We welcome everyone regardless of your race and identity. We welcome everyone regardless of your socioeconomic status. It does not matter where you come from, who you are. We want to make sure that we can do our best and put our best foot forward to serve the communities, especially such a vulnerable population in Harris County. I know that the data is scaring. Even for myself, being a Black woman of reproductive age and working in this, I see it every single day. I get the reports. I work with our epidemiology team. I see the data. So I just want everyone to know that we do not ask about any of that, and we welcome everyone into our program, and that's why we have such small requirements for entry into our program, is because we want to reduce barriers so that everyone can feel safe and comfortable being in our environment, being in our program, but then also welcoming us into their homes and their families.
Thank you. Martin?
So similar to what Ariana had said, for us at the Houston Health Department, we want everybody to know that we are there and that we have those resources available. One of the feedback we received with the community health assessment that was done that produced that graphic that I shared was that a lot of people are aware of our immunization and WIC programs, but they're not aware of our NFP programs, our Healthy Families program, or even that they can tap into some of the lead resources and environmental health services that we have, or our chronic disease program. And so we want everybody to be aware that we do have those programs available, and they do tie in to maternal child health. Because as I mentioned, we want to be sure that your health before, because we don't know. I don't remember what the statistics is, but it's large that a majority of the pregnancies are not planned. So we want to make sure that you are taking care of yourself before pregnancy, during pregnancy, and after pregnancy. And we have resources within our area to support you. And if we don't, we work with partnership within our community here to ensure that you get the resource that you need. So just come in.
Thank you. Alejandra?
For Legacy, I think that there is a reason why we see the largest OB volume in the nation, and that is because we truly value our moms and our babies, and we continue to grow as an organization, but that is because we truly do put patients first, and our moms and our babies are high priority for us. And we actually just recently, my team received an expansion, and so we're actually expanding to have more perinatal navigators at more of our clinics. And so we want to be deep, even more deep rooted in the community, and we want moms to feel that they are not alone. We at Legacy, same as they just said, regardless of their race, income, status, they can always call Legacy a home. And for our moms, to know that they have the support, wherever that is that they may need, we're there to meet them exactly where they need. And in addition to some of the other programs that I also talked about, Legacy also has a lactation consultant. She's on my team. And so in addition to providing some of that preconception, health and support, also support for, the mom while she's pregnant, postpartum support, and then lactation support as well. Those lactation services can sometimes be expensive if they are covered through the insurance. And so at Legacy, whether you have insurance or not, we're going to see you, and for our moms to feel that they are not alone, that they have somebody at Legacy who will be there every step of the way.
Thank you. And lastly, Heather?
Yes, I think good job. I think that our takeaway is really empowerment. I loved your hire and fire. Our website is a wealth of resources about everything from signs and symptoms of stroke and heart attack to now we're growing our library of maternal and child health literature that is very patient friendly. And so we want to drive people to go there if they're not stepping into a clinic yet and they're not ready to take advantage of some of these services, they can go to our website, they can empower themselves to say, hey, my doctor's not listening to me. I think I'm having these signs and symptoms, which how many times do we hear that? And so really just empowerment and making sure we're working with our community partners to meet the needs of their patients and using the resources that we have to better educate our community on how they can take care of themselves. I will put a plug. There's a blood pressure station, one of our American Heart Association blood pressure stations that was right next to the check-in booth. Just that access that we're trying to get out there, that physical access, but it's there online too as that kind of first step. And we hear that a lot, that I Googled you and I realized women tell us all the time I was having signs of a heart attack and I didn't know it, you know? And so let's work together to use the resources that we have to educate one another.
But thank you, ladies, so much. There's so much great information. And please, everyone out there, for all this information, tell somebody that you may know needs this information, especially about the resources. Visit all the vendors that's here and get all the documents that they have. Tell somebody so they can tell somebody and tell somebody. I hope this is very informative to everyone. And again, thank you, ladies, for your expertise and your time.
Thank you to all our panelists. It was really informative about services that are available to us in our area. All right. I will be introducing a performance by our TSU debate team. The TSU debate team is an internationally renowned, started under the leadership of Dr. Thomas Friedman more than 70 years ago. The team attracts approximately 25 to 50 students annually. Students may be introduced to the forensic art for the first time or continue involvement with debate activities they may have started in high school. The debate team office is popular tourist attraction for visitors to the campus to see the thousands of trophies won by the team and the numerous photos of students in competition around the world. Other memorabilia in the office attest to the popularity of the campus organization, the certificates of achievement, merit awards, and proclamations for national dignitaries. Please welcome the TSU debate team.
Each year in the United States, nearly 700 women die from pregnancy-related causes, and hundreds of Black women die during pregnancy or in the year after.
Thousands more have unexpected outcomes of labor and delivery with serious or short-term, long-term health consequences.
Every pregnancy-related death is tragic, especially because more than 80% of pregnancy-related deaths in the U.S. are preventable.
Recognizing urgent maternal warning signs, providing timely treatment, and delivering respectful quality care can prevent many pregnancy-related deaths.
The Texas Southern University debate team is proud to present this Reader's Theater presentation, scripted especially for this occasion by head coach Dr. Gloria Batiste Roberts, entitled,
Everyone has a role to play in promoting Black maternal health.
Black women are 3 times more likely to die from a pregnancy-related cause than white women. Multiple factors contribute to these disparities, such as variation in quality health care, underlying chronic conditions, structural racism, and explicit bias.
Social determinants of health prevents many people from racial and ethnic minority groups from having fair opportunities for economic, physical, and emotional health.
The NIH, CDC, and community research initiatives like the CCMH Challenge are expanding community-driven research and outreach as essential tools to reduce preventable deaths and improve maternal health equity.
We must all work together to reduce Black maternal mortality.
Learn how you can support pregnant women in your life to reduce factors that contribute to pregnancy-related complications and death.
Pregnant women and their families can talk to a healthcare provider if anything doesn't feel right or is concerning.
Know and seek immediate care if experience any type of urgent maternal warning signs, including severe headaches, extreme swelling of hands or face, trouble breathing, heavy vaginal bleeding or discharge, overwhelming tiredness, and more. These symptoms could indicate a potentially life-threatening complication.
Share recent pregnancy history during each medical visit for up to 1 year after delivery. Connect with healthcare and social support systems before, during, and after pregnancy.
Healthcare providers can hear what you're saying. Listening can be your most important tool.
Hear her concerns. It could help save her life.
Healthcare providers should ask questions to better understand their patients and things that may be affecting their lives.
They help patients and those accompanying them understand the urgent maternal warning signs and when to seek medical attention right away.
Healthcare providers can help patients manage chronic conditions or conditions that may arrive during pregnancy, like hypertension, diabetes, or depression.
Healthcare providers can recognize and work to eliminate unconscious bias in themselves and in their office on an ongoing basis.
They can respond to any concerns that patients may have.
Healthcare providers can provide all patients with respectful, quality care, irrespective of their race or ethnicity.
Hospitals and healthcare systems can identify and address unconscious bias in healthcare.
Hospitals and healthcare systems can identify and address social factors influencing maternal health, such as unstable housing, transportation access, food insecurity, substance use, violence, and racial and economic inequalities. Everyone has a role to play in promoting Black maternal health.
The Black Mamas Matter Alliance serves as a national voice and coordinating entity for stakeholders advancing maternal health, rights, and justice.
The Black Mamas Matter Alliance is a national network of organizations and leaders from the maternal health, human rights, and reproductive justice fields who believe that everyone deserves access to quality and holistic health care.
Black mamas have always been the guide and bridge for families, communities, movements, and waves of change.
The time is now to invest in the advancement in the movement for racial and birth justice.
The historical atrocities are deeply rooted in racial and reproductive oppression, bent on controlling Black liberation, and must be countered with community activation and prioritizing Black mamas across the African diaspora.
Everyone has a role to play in promoting Black maternal health. Amita Parker shared a poem entitled Just Help Me, a research poem by Black mothers that tells the story of the maternal health and support experience of Black mothers in the Midwestern metropolitan context.
Several excerpts from that poem include,
and when asked about my mental health, I replied, I had it until apparently I didn't. I was stressed out at an all-time high, and I cried and I cried. I thought I was going to die.
Another mother said, pressure from every direction, it's a lot, all the time. Because of that, you just get tired, period, of life, just feeling heavy all the time.
Another mother said, when asked about support for her mental health, she said there were many things that came to mind. I have some that are like a root to my life, like some people in my life and God. They have supported me during tough times, my life and my faith. That's what's kept me going.
Everyone has a role to play in promoting Black maternal health. If I could just have more me time, that would help my mental health.
I need more time, period. Just time to listen to music, time to cook, or time to lounge, whatever. That stuff is calming to me.
When my mental health is at a bad place, I'm really kind of vulnerable. Trying to deal with stuff on your own, that's a real headache too. Everyone has a role to play in promoting Black maternal health.
If there was some type of support group for Black moms, That would be so helpful. What about a mental health life coach? Is there such a thing?
Someone that can guide me, you know what I'm saying? Maybe a talk line if you feel you're stressed. Someone who could be there for anyone, anytime, anywhere.
Everyone has a role to play in promoting Black maternal health.
We must all work together to reduce Black maternal mortality.
Everyone has a role to play in promoting Black maternal health.
All right, give it up one more time for the TSU debate team. All right, before I retire as the MC for today's event, I'll go over some quick announcements that we have. If you're on site today and you have any questions, you do have a note card within your folder. You can write the questions down, as well as check out the infographics and flyers that are within the folders. You can complete a survey using the QR code down here, as well as we are offering paper surveys. And if you need to use the restroom, they're available through the hallway in the lobby area. For online participants, please keep posting your questions in the Q&A box via the Zoom, and the survey will also be used either on the Zoom, on the QR code you see on your screen, as well as we have a member of our team posting a link which you will click and follow to complete the survey. This event is offering, it's a typo on the screen, but it's 3 CHW CE hours. You must complete the survey and evaluation to receive credit. We are also live streaming on Facebook as well as YouTube, so please feel free to share with family members so they can watch as well. And please follow us on all social media platforms at CECTX Southern U to stay updated on our most recent events as well as what is going on within the center. Lastly, we want to say thank you to our sponsors. Thank you to TSU MH Reach and TSU CBMHR CEC for co-hosting this event today, as well as a special thanks to the partners here at Harris County Harris County Precinct 4 for allowing us to use the center today for today's event. We'd also like to say thank you to all our sponsors, partners, vendors, as well as speakers and panelists who came out today for this event. Thank you so much. All right, we have a quick break. Please use the bathroom, get snacks if you'd like.
I remember this young lady, she had just gotten vaccinated. She's African American, and she goes home and she talks to her grandmother. Grandma, you need to be vaccinated. Grandma says, absolutely not. I don't trust the healthcare system. I don't trust any of these people. I'm not going to get vaccinated. The young lady says, well, Mom, the lady who vaccinated me is African American. She says, well, in that case, take me, I want to get vaccinated. The message is important, but so is the messenger.
Data and science and study have shown that African American individuals are much less likely to be enrolled into a clinical trial. So the EQB Med initiative is going to address this major and critical problem in our community.
EQB Med initiative positions us at Texas Southern University to actually have access to innovative and breakthrough clinical studies. We do a lot of work to increase awareness about clinical research participation, but without an opportunity to actually open access for individuals to participate and to build trust in clinical trial process, we are very limited.
Pharmacy is a very important team in communication with the community. And we are not only have our PharmD program, we also have a PhD program. With that, we have more outreach to the community.
We are the #1 producers of African American pharmacists in the state of Texas. Pharmacists are a significant part of the healthcare team. They're able to immunize patients. They're able to help them in a variety of health settings per se.
TSU had the RCMI support back in 1980s, especially in terms of research infrastructure. So the student and scientists can conduct most cutting edge research, especially in the area of drug discovery and development.
In 2024, the College of Pharmacy and Health Sciences celebrated its existence of over 70 years. We lead a lot of initiatives advancing health equity, training community health workers, providing continuing education for community health workers as well as for our pharmacy and health administration students.
In this initiative, we are going to partner with UTMB, Yale University, and Morehouse School of Medicine. We will be able to gain more experience and resources and guidance on how to recruit for clinical trial and how to conduct clinical trials.
So this clinical research initiative under the EQB-Med funding mechanism allows us not just to provide opportunities for clinical trial participation for community members, but it creates a platform for us to train the next generation of pharmacists that will be culturally competent, that will have an high level of awareness of engaging with community members to promote the concept of diversity and equal representation in clinical research participation.
Hello? Okay, welcome back, everyone.
Hello, everybody. I'm so glad that we're connecting with vendors, but if we can start making our way back to our seats, we're going to be starting the second segment of our session here very soon. After we finish our second session is when we'll also have lunch, but don't worry, these vendors will still be here throughout the entire conference. They'll still be here after we conclude. That way, when we serve lunch, you'll also be able to interact and mingle with them. So if everyone can start making their way back to their seats, that would be much appreciated. Try and do it calmly. I don't want to shout. everybody, if we can return to our seats. That was our 5-minute break to get everybody to the restroom. These vendors will still be here after this conference. You'll still be able to interact with them throughout it. And right after this conference concludes at 1 o'clock, we will be serving lunch, and these vendors will still be here with the hour afterwards. So if everyone can start making their way back to their seats, that way we can get back to making our presentations to learn more about maternal and child health. So please, everyone, make your way back to your seats, please.
Okay, welcome back, everyone. We're going straight into the next presentation on maternal health and nutrition by Dr. Nkechi Owo. Dr. Nkechi Owo graduated from Doctor of Pharmacy degree from the University of Minnesota, Duluth, and completed 1-year general practice pharmacy residency at Michael E. DeBakey VA Medical Center in Houston, Texas. She also completed a Master of Public Health in Public Health Leadership from the University of North Texas Health Science Center in Fort Worth, Texas. Over the past 17 years, Dr. Owo has worked in the retail pharmacy setting and most recently at Texas Children's Hospital for 9 years prior to joining TSU, where she's currently a research assistant professor and senior program manager, health services and community engagement. In her free time, she enjoys spending time with her family, traveling and singing at her church. She's also passionate about educating on financial literacy as well as healthy eating. Please, let's welcome Dr. Nkechi Owo.
Thank you so much. Thank you so much. And before I go on to my presentation, I want to just make our time to appreciate the leadership here at TSU. Thank you, Dr. Veronica Ajewole, for the privilege, Ajewole Moema, for the privilege to be able to speak on this topic that is near and dear to my heart. Dr. Olaleye, thank you also for this panel, this podium on this privilege. I don't take it for granted. Dr. Poon, I appreciate you, and everyone else. Thank you all for sitting down still, for not walking out, right? And realizing how important this is. Thank you. So I'm just going to go ahead. Maternal health and nutrition. Why is this important? Why is the type of food we eat important? It's important because for the mom herself, gives her more energy. More iron in the blood, and of course, when the mother's iron is low, that also affects that of the baby and could lead to also early labor, right? And it helps you take better care of the baby. It should have been better, baby. Sorry. So forgive my typo. Inside of you, for the baby, of course, it helps for brain and spine growth, strong bones and teeth, healthy birth weight, and overall, in general, just a healthy baby. Because I have just 7 minutes, I just want to just briefly touch on this. So this is the latest guidelines from the U.S. Department of Agriculture, and this pyramid used to be the other way, and now it's just recently been inverted. But overall, all I wanted to just say about this is eat more real food. That's it. Eat more real food. Okay? Short and simple. Short and simple. Our scientists, our medical doctors and stuff have mentioned so much stuff about maternal, about the mommy and baby and the deaths occurring. Now, one of the things that is in our power to control, we cannot control genetics, right? But we can control other things, what we choose to put in our mouth. One more time, we can control what we choose to put in our mouth. Gone are the days we follow the same recipe that caused blood pressure in our mommy, the way our parents cooked, right? Hypertension again.
So gone are the days. So please, which means let us readjust those recipes. Our grandmas, great grandmas will still love us for it. All right. Sorry, but I'm very, very, I'm from back. So I'm just trying to tell you as it is, which I hope is the way somebody's going to treat me, right? So, okay, now this is an important chart I want to show us, right? It's a classification system, and there are many variations, right? But this NOVA food classification system between group 1 and group 4 just tells us nowadays, because of technology and whatnot, the different forms of foods are now occurring. From group 1, whereby it's not as processed, the food is as it was when we farmed it out, to group 4, which means it is ultra processed and it's no longer looking like the original product, pretty much. Okay, and this is just what it's like. And just fun fact, when you eat more of the foods in group 4, most people tend to eat 500 extra calories. They are not as full. They get hungrier quickly. Hence, you go take more of this. So just FYI. Now, just tips to eating on a healthy budget. Tips to eating healthy rather on a budget. Buy more store brands and less name brands. Just fun fact: the same company that makes the store brands, right, and the brand name ones are made in the same place. Just that the label is different. So just FYI, when you see Walmart store brands, if you look in there where it was processed, it was more than likely made in the same company where your brand name products was manufactured. So just fun fact for you. Frozen veggies are healthier, can be and cheaper, and hence last longer in your homes. So don't always say, oh, I cannot, because if you are somebody who maybe does not eat as much, then you probably want to do that option so that your food can last longer and it doesn't go to waste. Beans and eggs are okay. They're not curse words. Low in cost and high in nutrition. Eggs, for example, right, has pretty much the total amount of the total proteins that a woman needs, a man needs, a child needs. So it's not a curse word. Cook once, eat 2 times, 3 times, 4 times, and I'll explain that later. You are not poor because you ate rice and beans on Monday and then ate it again on Wednesday. No, you're just being wise. Rather than stopping over at the fast food to get that whatever, if you have that left over, and if you're standing up anyways to cook, you might as well use a bigger pot and make 2 or 3 servings from that pot. Amen? Thank you. All right, so pack up your snacks from home. Right, your nuts, your yogurt, your fruit. And thank you to HHD, thank you to Legacy, thank you to American Heart Association, to Harris County Public Health. We can make use of SNAP, of the WIC, of Food Bank, of our church food drives if we need more help getting groceries or paying for stuff. And of course, use a meal plan. One more time, use a meal plan. So now, because I'm very short on time, I want to just leave us with this. Understanding what an ingredient label is. There are 2 different labels you want to understand, a nutrition facts label and an ingredient label. But permit me to just spend more time on this. An ingredient label simply lists every ingredient. They are supposed to list every ingredient, right, that was used to make a product. And it lists list is an order of the largest amount of each individual ingredient to the smallest amount. The less number of ingredients, the better. Okay? And then whole fruits and veggies, guess what, have no ingredient label because there is nothing to declare about it. And then minimize or avoid the ingredients not found in your kitchen. So when you're pretty much, that just says that when you're looking at your ingredient label, if you don't understand what it is, if it's not found in your kitchen, then you probably should put it down. Okay? Now, just fun fact, I had to just add this in there because I tell my kids this, and I try to tell everybody around me. Approximately 1 1 tablespoon of sugar is about 4 grams of sugar. And these are the various names of sugar. It's not exhaustive, but most likely when you see one also that has an O's, maltose, dextrose, OSE, then it's likely a form of sugar. Okay? A can of Coke has about 54 grams of sugar. Think of putting about 13 to 14 teaspoons of sugar into your body. And then lastly, here is your fruit I was mentioning, right? You don't need an ingredient label. You will not find it if you go to your Aldi or HEB or Walmart because it's as is. Now this part here, what is the first word we see here? It's not a trick question. What is the first word? What is the first ingredient here? Thank you. All right? So based on what we just learned about an ingredient facts label, right? The first ingredient here is peaches. That is the largest amount of ingredients in there, up to your ascorbic acid. After peaches is what? Water. Water is the next largest ingredient here. After that is what? Pears. Have we found cherries yet? Okay. Then next, we go to white grape juice. Concentrate. Then cherries. Now, these our cherries are what? Artificially colored red with carmine. Who knows what carmine is? Me neither, but it's a kind of dye. And after that is what? Your lemon juice, concentrate, whatever. So next time you want to eat some peaches, just go eat this. Make sense? The hardest job in all this, since you are going to be opening this, you might as well just use a knife and cut this if you need to be bougie, or just pick it up with your hands and eat it. Now, fact check, talking about oatmeal. For those that like oatmeal, did you see the ingredients here? So according to what we learned, this is an ultra processed. This is not. Your ingredient here is what? Whole grain, rolled oats. I'll pick up this if I were you. This one here, I know you wanted your peaches and creams, but like I said, next time, just get this one, cut up some peaches, and eat your oatmeal. Because what else are you having here? You have sugar, peach colored, and whatever. You have some creaming agents. Is that found in your kitchen? All right, I'll leave it at that. Make sense? All right. And then if you don't mind me just adding something quite small. I didn't talk about a nutrition facts label, but just a slight example of what you want to be looking at. This fiber here in this one, it's telling you it's 2 grams. In the regular oatmeal, that is just oatmeal, it's what? 4 grams. Added sugar is 0. Added sugar is 9 here. Right? Your protein here is 3 grams. Your protein here is 6 grams. Now, if you were to put the sugar yourself, let's say you're somebody who likes something really sweet, you might have probably just done 2 teaspoons of sugar if you wanted, or some honey, right? That would not have been 9 grams of sugar. All right. Then while a meal plan, it helps you save time, less chaos, reduces and eliminates anxiety and stress, helps you to eat healthier, and really saves money in the long run. Meal planning tips, make your list in advance. Okay, if you're planning for a trip, right, you have to check how much money you have and all that. Do the same with your food. Note your busy days. We are all working mothers and stuff. You know you are coming back. You know on Tuesdays and Thursdays are your late days. That is not the time to think of making a 5-course meal. Because by the time you come home, halfway, you probably will stop by somewhere to get some food. I'm saying it because I'm a mother too, I work. So on those days, I probably have leftovers ready to warm up and eat. Okay? Also, plus it gives you more time with your kids and stuff, right? To help with homework, and you can go to bed faster. Okay. Keep your meals simple. Keep it simple. Let it have a complex carb. Let it have your veggies. Let it have your what? Your protein and your good. Consider meals whose ingredients are on sale or in season. Okay? And it's okay, like I said, to recycle the same meals in the same week. Introduce a maximum of 2 new meals a week, or you can just do 1. That is perfectly fine. And have a to-go meal in case of emergencies. Okay? Invest in storage containers. Those things are your best friends. And then this is an example of ingredients we're proposing. Maybe on Sunday you had some nice chicken, you had family over with some rice and whatever. On Tuesday, nothing is stopping from making some tacos with those chicken. On Thursday, have a nice pecan chicken salad or whatnot, right? On Saturday, when it's cold, make a what? Chicken noodle soup. What can I do to start? What can I start now with? Eat more real food, plain and simple. 1 or 2s, okay? When it comes to the class, which is eat in colors. When you eat in colors, you're making your insides brighter with antioxidants. Broccoli has stuff in it that is anti-inflammatory. Drink more water. Sometimes we think we are hungry, but we're just thirsty. Okay? Practice meal planning. Start with 1 change a week. And I hope as you leave here today, you have already started to think of what that 1 change is. Thank you very much.
Thank you so much, Dr. Obo. That was very enlightening, and I hope you took something home with you. Make it practical. Next, we'll be moving to the next presentation. We're going to be welcoming back Dr. Ivy Poon. She's going to give a presentation on MH Reach Investigator Development and Training Corps.
So funny, and she doesn't even know that she's funny. Do you know that you're funny? You're so funny. So I am going to do cook once 2 to 3 times. That's what I'm going to do. Yes, ma'am. Wow, so much wisdom. So in the next several minutes, I'm going to go through the training core. So in the Maternal Health Research Center program at TSU, we have the MH Reach Training Core, and I'm going to report on what we have done so far in the past year. So I am the training person. So I have been teaching at TSU for about 20 plus years. I love to teach, and I love to kind of like know how students learn and how to motivate them. And so that's how I serve in this capacity. So the training core has 3 main aims. The first one is to develop training programs, some sort of curriculum, structured programs to teach maternal health topics. You'll be very surprised that even like I've been teaching in pharmacy school for 20 plus years, our focus on maternal and child health is very little comparatively, because we just focus on adult population, like general population. And then we, add in a little bit about pregnancy drugs, we add in a little bit about infant health. And so it's not complete when I look back at the curriculum. So number 1 is to create some sort of curriculum to train. And number 2 is to foster some mentorship to motivate the learners in research, in learning about more. So as you heard about the MH STAR program that Dr. Olayeye have done, we heard stories of trainees from her program. After they were trained, they went on to get the master program and the PhD and postdoc. And that's what we want to foster, that motivation to get into the area, learn about public health, epidemiology. So the last aim is for evaluation. And we want to see how our curriculum has been and what are the things that we want to improve. So in the past year, one of our main initiatives is to continue with the summer high school program. And it is unique because we are the College of Pharmacy and Health Sciences has pharmacy program, but we really don't have much experience in training high school students. until we start MHRich. So, it has been a very exciting journey, and every time when I, work with the high school student, I'm very impressed by how much they can do. And it is always good to start early when they are exploring their career options, and when they're still early, when they're living, learning through life, to kind of expose them about what is public health, what is maternal health, what is epidemiology or environmental toxicology and stuff like that. So in the past year, in the summer of 2025, we have trained these high school students. So we had 20 of these students. In 2024, the last year when we first started, we had 10 students. So we doubled. And we're so blessed to have them. And they have done so much that when we plan for this curriculum, so the idea is we first teach them through some online lessons, because every one of them sort of like start from ground zero. All they have been learning were biology, physics, and chemistry, right? If they're 9th grade, 11th grade, 10th grade, they don't know much. So we start with some online lessons, and it's asynchronized. And then they do some reflection. They also do some online quizzes. And to get them kind of like at the level that we want them to be, then they, being followed by a month of hands-on research experience through some of our leaders in the research projects. So we asked them, so these are some examples for some of the responses from the reflection activity. So we have 9 online lessons, and out of those 9, 4 of them, the topics is listed on here. So we have one in cardiovascular disease, one in cardiovascular disease, and one in mental health, one in environmental exposure in pregnancy, and one in contextual factors in health and community support. And these are some of the responses. These are responses from our high schooler. So one of them said, I learned the importance of speaking out about things that can prevent things like preeclampsia, because a small dose of aspirin could save so many other people's lives. Isn't that amazing? Like, as a high schooler, they know what is preeclampsia. So it's wonderful. Another one say, I learned that it is important to check up on new mothers, because we don't know what they are going through unless we ask and lend a listening ear. You feel that empathy being developed in their mind? Beautiful. One said the best solution to public health is to enforce environmental regulations while giving companies incentive to go green. This protects public health and lets industry stay profitable through innovation. So in these lessons, our postdoc actually go through, there are some areas in the city and also in the country where they are more exposed to environmental toxin versus the other. And since the babies are so vulnerable, and during that stage are so vulnerable, it's very important that they stay healthy and not being exposed to these toxins. Another one say, if I were a community health worker, I'll focus on improving access to prenatal health, since early support can prevent serious risks for moms and babies. I'll be interested in being a CHW to help people feel heard and support their health journey. And do you know that high schoolers can become a CHW? Yes, they can. Yes, they can. They can. So we are working our way to connect them, for those who love to be a CHW, to get them trained to become a CHW. And so these are these wonderful things that they have said. In your booklet, you will see that poster. We print out that poster. So we have 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5. We have 5 posters. So they work in groups for that 1 month hands-on research projects. Now these projects, it's a little bit like baby projects. They are not really projects that could be, published in a journal and such. Not yet. But it is a first step to get them to be exposed to how to do a research project. And all of these are being guided by our research staff. So you can take a look at the projects that they have done. One of them that I want to highlight as you're going through the booklet is one of the high schooler group, actually developed a pamphlet for teen pregnancy. So it is developed by the teens for the teens, and which is wonderful. And that group of students, one of them came from the Alief ISD area. And Alief ISD has one of the highest rate for teen pregnancy. So yeah, so I just felt every time when we work with the high schooler, I'm very amazed by their ability. So these are some of the additional things that they said, that they learned. Due to time, I need to go faster. So we have published it in the first cohort. We have, and we have submit another paper for the second year cohort. And in the next couple of slides, it just highlight our postdoc. Dr. Grace Oluwunyomi is here. She was the one who introduced me. She might be behind this wall. She has done several posters. So this is a poster that was presented at the American Public Health Association meeting in Washington, D.C. Grace has 2 projects going on. Her interest is in PFAS exposure, folic acid, and also how to educate mothers or pregnant mothers about exposure to PFAS, to prevent exposure to PFAS. So this is a summary. I also want to highlight that since the beginning of MHReach, Dr. Jasmine Jones, our host for this morning, she developed 2 classes, 2 lessons in our PharmD curriculum. So thank you, Dr. Jones. All right, so if you are interested in any future programming for high schoolers or undergrad or grad student, please scan this QR code. We will send out periodic newsletter or emails, connect with us. If you have high schoolers at home who will be interested, scan the QR code. So we will be recruiting the next cohort very soon, like around March time. Thank you very much.
Thank you so much, Dr. Poon. Give it up for Dr. Poon. Okay, we'll be going to our next presentation on MHReach Community Engagement Core by Dr. Kimberly Pounds. Dr. Pounds has over 25 years of experience developing programs that address disparities in health through community engagement and participatory methods. As a trained health educator and researcher, our work has addressed tobacco prevention and cessation, cervical and ovarian cancer survivorship, women's participation in chemo prevention trials, women's decision-making in health, and pharmacist home-based model diabetes and hypertension management. In her current role as an associate professor in the College of Pharmacy and Health Sciences, Health Administration program, she trains health professions students in development of community-based programs. Dr. Pounds also serves as the co-director for MHReach Community Engagement Core. Please let's welcome Dr. Pounds.
Good afternoon. Thank you, and thank you, Dr. Ajwale, for having me on the agenda. This is a real treat. I love sharing information about what we do as part of the community engagement core of our Maternal Health Research Center at TSU. So I'm really proud of the collaborations that we've managed to build through the work that we do in the community engagement core. This is just an overview of some of the partners that we work with and some of the primary, I would say the primary aims of our core is one, that we support community organizations in the community. We partner with them to do activities like baby showers. We do our diaper distribution and resource bag distribution, such as we have today. So we partner with those organizations like the Nurse Family Partnership. During the graduation of their participants, we come and we provide information to their participants. We also work with organizations like the Texas AHEC East of Greater Houston region. That particular group trains our community health workers. We sponsor scholarships for women in the community who want to become community health workers. And I'm going to talk a little bit about that as we move through the presentation. So this is just another list. Family Scholar House is one of our new partners. And what we do is, as a community engagement core, we see community as the community of mothers across Houston and Greater Harris County. What that means is that we not only focus in the communities, but we also focus on our on-campus community. So we also sponsor baby showers and educational opportunities and activities for moms on our campus, including our students and our employees. We have an intern who is a single mom who saw a need to begin a support group for moms. And so that's something that she's actively doing on our campus this year. Family Scholar House is a group that we brought on campus to talk to our advisors. How many people have heard of Family Scholar House? Family Scholar House is a jewel. They are a jewel because they support the education of mothers and fathers who are single and pursuing educational degrees. They actually have a complex located in 3rd Ward. If you're interested, all you have to do is reach out to us and we will connect you. What they do is, through that service, they provide housing to single fathers and mothers. They provide housing for them as long as they have at least one child, and they assist with tuition, they assist with services like tutoring, job coaching, and let's say you're a student who's getting, who started at HCC and you're getting an associate's degree. You can actually live in their housing facility for those 2 years. If you are in an undergraduate program, same thing. If you're pursuing a graduate degree, you just have to be in school and you have to have children and you have to be single, okay? So this is what we do as part of our core. We share information about what our partners are doing so that we can build the knowledge of our communities. We couldn't do any of this work without the phenomenal members of our Community Advisory Board. I'd like for Ms. LaToya Shields to stand up, because she is one of those phenomenal members. And we're really pleased about this advisory board because they have rich experiences. Not only do they work in the field of maternal health, but we also have some members who do not work professionally in maternal health, but they're living the experience. Thank you. So our CHW Scholarship awardees, these are 6 of those individuals. We're really proud of this class of women. 2 of these women, again, looking at that partnership and networking, actually came from Family Scholar House. They were residents at Family Scholar House. So we were really proud to be able to provide that opportunity to some of the residents. This year, I'm excited because we started out with maybe, you know, a little bit of interest here and there as we would go out and publicize it. And this year, we have about 15 people that want one of those 5 spots. And so we're growing. I think the interest is growing in this profession of community health work. And so again, we work with Texas Area Health Education Centers of Southeast Texas. Just a big shout out to them because they've been very helpful in accommodating our cohort of students. So we provide the scholarship to them, so we pay their tuition for the certification through the state of Texas. At the end of the program, Texas AHEC also has a HRSA grant for what they call health scholars. So at the end of the certification, the women also get a stipend for their participation. This is just an example of one of the activities that we do on our campus. Last year, we had our on-campus community baby shower. We had about 40 moms that came, both employees and students, and we were really excited about the event. It was a time to share resources, but it was also a time on campus where we started to get calls from people across campus that were in contact with students that needed help, and so that was really rewarding to us to be able to have that kind of impact. If you're interested in participating or learning more about what we do, please take advantage of the QR code. Ms. Kennedy Norwood, I'd really like for her to stand. She didn't want to come up here. She's kind of shy, but she is really at the heart of what we do. She's always in the community networking. Some of you stopped by the table. We were able to share our information, but please reach out to Ms. Norwood. She is more than happy to connect with you and see how we can work together. Thank you.
Thank you so much, Dr. Pounds. Give it up for Dr. Pounds. Okay, straight away we'll be moving to the next section, which is going to be a panel discussion section on the factors impacting maternal health. Our first panelist is Felicia Latson. Felicia Latson is a passionate advocate for change, which she has exercised through a career as a social worker, professor, and business owner. As a returned Peace Corps volunteer and a resident of Houston's historic Fifth Ward, she is most inspired by the community activists who initiate change using the tools available to them. She is the owner, founder of Bloom Point Care and Consulting, providing mental health care, training, and consulting on a range of subjects, all with health outcomes as a graduate principal. She also serves as an adjunct lecturer with Baylor University's Diana R. Garland School of Social Work. Let's welcome Felicia Latson. Thank you. The next panelist is William Lyons. He's a licensed clinical social worker and seasoned supervisor with over a decade of experience spanning clinical mental health, case management, nonprofit leadership, and community organizing. At Legacy Community Health, he leads innovative programs addressing social drivers of health to improve outcomes across Southeast Texas. His expertise include trauma-informed care, motivational interviewing, and critical time intervention. William also consults on regional initiatives focused on maternal health, environmental resilience, and workforce development, and continues to provide psychotherapy to adolescents and transition-age youth. Welcome, William. The next panelist is Latoya Shields. She is the director of the Harris County Pathways Community Hub under the network of behavioral health providers. She's a proud double alum of Texas Southern University and serves as an adjunct professor in the Barbara Jordan Mickey Leyland School of Public Affairs, as well as a field instructor with the Department of Social Work. With more than 20 years in the social service field, Shields is dedicated to addressing maternal health outcomes and preparing the next generation of leaders through teaching, mentorship, and community engagement. Our work is deeply rooted in faith, compassion, and a lifelong commitment in helping families thrive. Welcome, Latoya. Next, we'll be welcoming back Dr. Jasmine Jones. Your favorite MC. And lastly, on this panel, we'll be welcoming Dr. Veronica Ajewale Mwema. Dr. Ajewale Mwema serves as a professor of Texas Southern University, a professor at Texas Southern University, and a clinical pharmacist and an adjunct assistant professor of oncology at Houston Methodist Hospital. She received a PharmD from TSU and completed an oncology pharmacy residency at Houston Methodist Hospital. She is a board-certified oncology pharmacist with clinical practice in oral chemotherapy, Houston Methodist Hospital Cancer Center. She is the founding director of the NIH-MD-funded Community Engagement Corps at Texas Southern University Center for Biomedical and Health Research and TSU's Institute of Health Empowerment and Advancement Research and Training. Dr. Ajewale Nwema is the program director of TSU's Breast Cancer Screening and Prevention Center, and she's the host of this conference. Please give it up for Dr. Ajewale Nwema. Louder, please. Thank you.
Thank you very much, Grace. I appreciate you. Good afternoon, everyone. It is such a pleasure to be here with all of you. Thank you for staying, steady. I know we've been here for a couple of hours, and I'm sure that the past few hours has been amazing, right? We've learned a lot of good things, and this panel session is going to be even more enlightening for each and every one of us. And to my panelists, thank you so much for being here with us today. Well, before I go into the questions, I will just start off by sharing a little bit about what this panel is going to be about. So last year, as part of the MH Reach Center, I lead a project. Under that project, our goal is to evaluate the influence and the impact of non-medical drivers of health. And how do these factors impact the outcomes of mothers and babies, right? So for us to be able to identify what the problems are, we took a step back and said, let us have a conversation with the people that are impacted in that group. So we started out by having a series of focus groups. We held 13 focus group sessions that consisted of pregnant women, healthcare providers, support system, all addressing and around the topic of maternal child health outcomes. So as part of that focus group, the panelists that are here today are individuals that participated, that actively contributed, and Ms. Felicia Latson was the facilitator for that focus group session. So please, big applause for you, Ms. Felicia Latson. And I see in the audience several of the individuals that participated in the focus group as well. So thank you all for joining. Some of them are here in-house, some of them are online. And if you would like to know more about that project, we actually have the summary of it on page 10 in your booklet. So at your convenience, feel free to look through your booklet. More information about the project is on the 10th page of the booklet. So without further ado, let me go straight into the panel session. All right, I will start with you, Ms. Shields. Okay? So would you please tell us what this work group revealed about the importance of collaboration among healthcare professionals in maternal care?
Yeah, it's a great question. Before I came up here, I was like, well, wait a minute, the debate team already answered all the things for us, but nevertheless, one of the things that's really important to understand about maternal health care is that it's collaborative. It's not a siloed type of work. From the keynote speaker to everyone that's come up on stage today, you heard that it's complex. It's detailed. There's environmental factors, there's STI issues, there's nutrition, there's all of these things that can complicate this particular piece of work. And so we cannot work in silo, we have to work in a collaborative fashion. And so one of the things that I took away from the work group is that if you work in partnership and in collaboration, you have all of these different folks in the space. So you have a William from Legacy, you have myself, you have Dr. Jones, you have actual people who are pregnant members of the community. We had a OBGYN that was a part of the group. We had some advocacy members, and I see a couple of them out there. Doulas, you have all of these people with various areas of expertise, and we can all come together, not knowing everything, but knowing what we need to know about our piece of the work, and we can put it together. And that way we can say, okay, what do you know? What do I know? Put it together. And then we can start to identify interventions. And interventions that, for this for this particular piece of complicated work, it's not just interventions that are clinical, and it's not just interventions that are social. We're bringing both of them together. And so now we're able to, as some of the senior saints used to say, now we're able to cook with grease, because now we have kind of something to work with. Yeah. We're not playing in a siloed type of field. We're playing where we're having all these people with all this expertise come together, and we're like, okay, you have that, okay, and then we can share resources, right? So I didn't know that you had that. I didn't know about the the food to medicine piece at Legacy before William was talking about it, and so now I'm able to, and all of my clients that I serve, they go to Legacy. I had no idea, so now I can promote a resource that I didn't know that was there. And then the other thing that we're doing is we are creating a mutual respect across all of these different disciplines. And once we can respect each other in various disciplines, then we are mirroring what it looks like for those that we serve to be able to respect that we can give them the care that they need.
Very well said. Thank you so much. I mean, I honestly, for me, being the principal investigator of that research, my role was just to ask the question, right? That was all I had to do. And I'm just so grateful that we came in contact with Ms. Felicia Latson and, pulled together the team, and we're able to have this cross-collaboration, multidisciplinary, especially when the pharmacist aspect came in. They were like, wait, what? Like Dr. Poon said, in pharmacy school, I'm a pharmacist by training. In pharmacy school, pregnancy was barely never talked about, except, okay, fetal risk and all of that. But when it comes to day-to-day management of things, this work group really helped us to uncover some of these critical interventions that we will be implementing in the community in the upcoming months. I will move over to you, Mr. Williams. Would you please let us know which challenges to maternal care stood out to you the most, and why do you think these challenges still persist?
There's so many.
Glad you got that question.
Yes. I think what comes to mind is the knowledge vacuum. So I think what came up most was that there were so many options and ways of going about it. And so how do you sit with a mom and explore all those options and not overwhelm, right? So we have all these programs, we have all these resources, and then the person's like, well, what do I do? And so I think sometimes in our attempt to help someone, we overwhelm them. And how do we, create an opportunity for people to have access to the information, but then create a pathway for them to make a decision when it's most appropriate to make that decision, right? So do I need to decide, my delivery today and I'm in my first month of pregnancy? Or is it more about, hey, I know you are recently just got Medicaid and you've not had any type of primary care services prior to being pregnant. How about we get you established your OB/GYN, but then also make a pathway towards starting PCP care as well, right? So we just recognizing that sometimes we need to do better as a healthcare facilitators to help people make decisions that are most appropriate at that time.
Absolutely. So you see, again, us pulling out to say now, we've identified that knowledge. How do we help patients to advocate? How do we help them to walk through all the available pieces of information so that we are not duplicating resources? Because sometimes they can feel overwhelmed, right? We don't want the patients to feel like we are dumping everything on them, but gradually guiding them through the decision-making process. That's awesome. Thank you for that highlight, Mr. Williams. Ms. Latson, I will give this to you. Did anything shared during the discussion challenge or change your perspectives about maternal health? If so, how?
Yeah, so, go ahead. Okay, so I'll add a word to that sentence, and I'll say there were things that expanded my conceptions about maternal health. The groups were very validating to us that do this work, because the things that came up about navigating systems and difficulty in accessing things, like these are all things that service providers we know anecdotally, but it was good to have it captured from the community and people that are directly experiencing them, and then to have it codified in research. But I'll say the story that I heard that really expanded my understanding is that, yes, we're doing all of this great work regarding maternal health and Black maternal health, but this was the first time in this group that I also heard the inclusion of stories about women who are incarcerated and who are navigating pregnancy through incarceration and post-incarceration. So the specific story that really just jaw-dropped me was a young lady that was going through, she was in pregnancy at the beginning of her incarceration period, and even when she came out, the interplay of the systems that she had to navigate after or while delivering her baby, in terms of like just being administered certain medications that could have impacted her probation, right? And so those are things that I had just never thought about in all of my years of doing this type of work, of just like, it's not just about the pregnancy, it is about all of the systems that are coming into play that a person has to navigate. And once they have these labels attached to them, and how that continues to perpetuate some poor outcomes for their care.
That is awesome. And if I can put a plug out, if you need someone that really listens, that's Miss Felicia right there. I don't know how she does it.
I'm a therapist.
Hey, honestly, when TSU debate team, when they were saying, do you want to talk to someone? I'm like, hey, go talk to her, because she's really gifted in listening. And in each of those sessions, you could see women opening up stories that they had never shared with anyone before. Like, these are stories that are life-changing, and now they've chosen to repurpose that painful moment into something that, can be paid forward to make livelihood and the maternal health landscape better for themselves and for the community. So just very grateful. Thank you for that response, Ms. Latson. Dr. Jones, I will pass this over to you now. What did you learn about how pharmacists currently perceive their role in maternal care?
Yes, through my work with this focus group as well as MH Reach, I've had an opportunity to work with various, populations and their ideas of pharmacists in maternal care. So I think from this focus group going in as a pharmacist, I was a little hesitant on, not hesitant, but not really sure how a pharmacist would fit into maternal care, as it's not something where it's driven into the curriculum as a pharmacist. All I was really taught mainly about pregnancy is that you're gonna give them a Tdap shot at this time that week. That's all you're taught. And you're taught like these hypertension drugs, but when do I start them? How do I monitor a mother? How do I make sure they don't go from hypertension to preeclampsia to eclampsia? So I think going in, I had an open mind, but I was very curious and I think hesitant to understand how a pharmacist would fit into that space, as well as I've done work with Dr. Poon and Grace where we interviewed pharmacists and how they would feel about more maternal health education and integration into maternal care. And I think they had kind of the same perspective as I had, is that it's interesting, and we're interested, but we're curious or a little hesitant in becoming full providers in maternal care because we don't have like a strong background in it in education. And then, as Dr. Poon had said, I got to work on developing some lecture material for PharmD students on two maternal health topics, which were mental health in pregnancy as well as hypertensive disorders in pregnancy, which were big topics that were brought up in this focus group. So it was really good to not only teach guidelines on it, as well as give them real life feedback that we got from this focus group, and to see like their eagerness of learning about maternal health topics really shifted my perspective on how we can be effective in maternal care.
Perfect. Thank you so much for sharing that insight, because, as I was reflecting there, it's obvious that in our PharmD curriculum, we are taught more on how to manage after the incident has occurred versus prevention, right? So most of the conversations we had during this focus group was to say, okay, how can a pharmacist be embedded into that preventive mechanism? And that is the phase 2 of this study, which by the grace of God will be launching this year, where we would now have a pharmacist implementing the interventions that we've co-created. This intervention is developed by the community for the community, and it will be implemented in this community. So I'm very excited about that. You'll be on the lookout when we are ready to launch. We'll be sharing more information to everyone involved. So that's great. Thank you again, Dr. Jones, for sharing your insight on pharmacist role. Ms. Latoya, I'm coming back to you now. How did the lived experiences or perspectives that were shared in the work group influence your understanding of maternal health gaps?
Yeah, so just a quick little background. One of the reasons why I'm in this space is because I had my own maternal health disparity experience in the system. And so it drove me to kind of curve my appetite to come to this space versus the space that I was working in before. And so when I read the word gap, I'm like, it's still there. That's one of the things. My oldest son is 22.
Maybe even widening.
Yeah, my oldest son is 22, and that's when I experienced this disparity. And so it's there. And despite all of the programs that you heard earlier, you had Harris County here, you have your list of folks back there, your resource tables. I do work. Everyone is doing work, and a lot of people are doing work in the space, and we still have gaps. So for me, when I was sitting in the work group and I'm listening to people talk, and then I'm kind of reviewing and doing a throwback to my own experience, I'm like, there has to be something else. And so I immediately, I don't want to always accuse, but I'm like, something else has to be done, and we need to do it a little bit differently. So I go to, if we're doing all of these things and we have all these programs in place, then we need to turn to the system, and we need to look at the systematic barriers that are in place. And whatever those are that are driving this gap from here to there, and 22 years later, looking at our keynote speaker showed us all of the data where it has not shifted. I can only look one other place. And so now all that's telling me, and the group just reinforced and reaffirmed, that after we're doing all of these programs, after we're putting prevention things in place, and we're doing all the things that you say, people are still dying, women are still dying. Last week, I went to DC to have some conversations about the same thing. And then the same week, Harris County released, there is a published report from the GRIO that says Harris County, the county that we are in, is the deadliest place for a Black woman to give birth. That is egregious.
Heart-wrenching. When I saw that report, I'm like,
that's egregious for the amount of money that we put into this, for the work that William and I are doing endlessly, for the work that some of you all are doing out there. So now what are we doing? We're going to look at the system. And I think that we look at the system, but not as much as we need to. So we really need to go back, and we really need to tear that system up. And we really need to identify what is happening in the system. Is it a training issue with our physicians? What are you teaching? What are you teaching wrong? What are you not teaching well? And then look at biases, put some things in place, help people to understand, you do have a bias, whether you want to believe it or not, and how to address that. Not saying that you can't be in the field, but how can you be aware of it so that you won't miss someone dying in front of you? And so I'm saying that when I see the word gap, we still got an issue. Those women in the group were still talking about it in 2025, and shouldn't be. So that's
absolutely very well said. Honestly, sitting here and we're like, yeah, not only do we have the gaps, it seems to me like the gap is maybe even widening. Right? It's a little wider. There's a lot of complications now, than what it used to be. And even people are more hesitant to seek care. But what I would say to the community is, hey, we are here in Harris County. Information sessions like this is aimed at empowering people. Please leave this place, be empowered to be able to advocate for yourself. Ask the right questions. One of the panelists earlier said iron fire. right? If you feel like that physician is not listening to you, if you feel like, the system you are in is not working for you, then maybe it's time for you to consider a change. Bring someone along with you when you go for that appointment, or call a friend on the phone. Let them do a video call with you while you are in the room, so you are not the only person listening. Because sometimes when you're in that chair as a patient, things get filtered through and you're not really engaging in the conversation. So bring someone along who is neutral, who can help you synthesize the information so that, again, you are empowered to advocate for yourself and for myself and for my family and for this entire community. So thank you so much, for sharing that. Thank you. I will turn now to Mr. Williams. In what ways, if any, did this focus group impact your practice at Legacy and the approach to the great programs that you guys have? Did this program, impact any of the any of the initiatives that you have in your system?
Yeah, I think there's a few things that happen. One is creating more access for our food prescription program. So we expanded it to include at-risk pregnancy as a diagnosis that could qualify someone and they having food insecurity. So that at-risk pregnancy could be related to anything. But if they are also experiencing food insecurity, here's a food prescription for you. And sometimes it's people who start care late, right? So I'm in my third trimester, I'm just now starting my prenatal care. So that could be considered at-risk pregnancy, and even though you're only maybe pregnant for another couple of weeks, here's a food prescription, you can still have access to it 12 months postpartum as well. I think the other thing that has happened is Legacy has expanded our prenatal navigation. So we used to only have it primarily at one clinic in our Southwest region, but this last kind of 6 months or so, we've expanded to all of Legacy. And so that's to help navigate people through the pregnancy process, through postpartum care. The other thing that we've added has been around access to mental health services. So I advocated saying, hey, this is what's coming up in these discussion groups. What can we do? So our director of behavioral health services, get some grant funding and some other things, got some clinicians trained, and so now we're able to offer that prenatal postpartum care for patients in our population that's specialized, right? So this is not someone who's just gone through therapy. Credentialing might have a wealth of experience as a therapist, but specifically in postpartum prenatal care. So those are some of the things that we've done that have helped support and facilitate at Legacy.
That's awesome. Really, really glad to hear that, this focus group is not just having impact in the community, but even within your system. So very happy to hear that. Thank you for sharing. Ms. Latson, I'll come around to you now. What do you hope others who were not part of the discussion, because obviously it was only, a handful of us that were there, what takeaway would you like to share with them from the conversations?
Yes, so for this one, I'm going to use my notes because I feel like when I'm given the privilege to represent community voice, I need to not change their words and I need to let community voice really be heard. So just bear with me as I kind of go down this list and then I'll come back to a summary. But what the group wanted to highlight is that systems should not assume that because they are creating programs for people who may be low income or on Medicaid, that the assumption should not be that these people have extra time and that they're not working and that they should not have access to virtual services or evening or weekend services. So also not making the channels or access points to these services laborious, meaning that, you have to come in person to do an intake, or you can only get into our services if you happen to know the right person and the right phone number and call at the right time, right? So having multiple intake points and multiple ways to access these services. Also having requirements that are broad and streamlined as possible. And so there was a mention of, when there are incentives for some of these programs, if a person has to attend 12 sessions of something before an incentive is awarded, who are we doing that for? Is it really for the person? Is it really for the person to benefit them, or is it, the system gatekeeping some type of resource? We all know the importance of having culturally responsive and culturally tailored programming and communication and outreach that can reach a broad sector of the community. And so that goes beyond just having things in English and Spanish. That is truly important. Like if these programs are not offering materials in a bilingual format, you're really leaving out more than half of the population at this point. But also when you emphasize having outreach materials that are written in English and or Spanish and are broadly accessible to all reading levels, you're incorporating people who have different levels of literacy. Maybe they're at different stages of learning English. They may be Spanish speaking, but maybe they're not literate in reading Spanish. And so having materials that still allow people to access the information through pictures and clearly defined requirements, that's gonna be key. Also having enhanced collaboration within the system. And so having systems that don't require a person to repeat their story multiple times to the receptionist, then to the MA, then to the doctor, and then to the social worker. So refine your systems internally so that all of that communication is shared and it centers the client. And then lastly, having a healthcare professional, that was one of the things that came up, is yes, having a healthcare professional that is trained in medications and contraindications for medications, but also that's knowledgeable about food, the impact of food on certain medications, in addition to how that all plays into pregnancy. So hopefully pharmacy education is really going in that direction and can highlight some of that. So yeah. Oh, wait, and the most important and last thing, someone brought up the fact that we can't expect women or people to learn how to just advocate when they get pregnant and to start practicing that muscle when they get pregnant. So teaching young people to advocate for themselves and advocate for their bodies and advocate for their health, that's only gonna strengthen that muscle, right? It's like expecting someone to go out and jump into the ocean and swim for the first time. No, that education needs to start earlier so that when it's crucial and when it's time, they can speak up and say, I'm having chest pains, or this doctor did not treat me right, and they can learn how to fire their team.
Absolutely. Thank you. Thank you so much for sharing that. And thank you to all the community members that participated. I feel like this is a gold mine, right? You know, like now we've uncovered a lot of, possibilities that by God's grace we will put into implementation in upcoming months. I'm really excited, as we transition into the implementation of the second aim of this project. Dr. Jones, I would pass this back to you. How did the work group inform your understanding of the level of trust, concerns, or misconceptions patients might have around medication safety in pregnancy?
Yeah, that's a good question. I think it was very eye-opening of what, not only like what mothers understand about medication during pregnancy, but also like their practices of managing medicine during pregnancy. We had one mother say that she was scared to take anything during pregnancy, so she avoided it. And that opportunity could have been a good opportunity to speak with a pharmacist, and we could have gone over the risks of taking this medication and offered an alternative over-the-counter medication. I think also what was eye-opening is that there's a lot of medication information and medical information in general being spread through social media, and it's heavily influencing decisions that mothers are making, whether that is a good decision via like lived experience, or maybe not something as clinically or evidence-based decision that could be potentially harmful. So I think that's like a good opportunity for not just pharmacists, but other healthcare providers to provide resources to counteract some of the misinformation that is gained through social media. It's really our opportunity to stand up and defend evidence-based practices so we can ensure that not only the mother is taking effective medication, but the baby is safe while she's taking those medications.
Thank you very much, and I'm glad you brought up social media, right? Social media is very accessible, and sometimes it can be misleading, especially if people don't know the right level of information to access. That's awesome. Even though we still have time, but overall we are running over, but I would allow maybe 30 seconds for each of the panelists to just briefly share with us, is there anything else that you'd like to tell, the community and the attendees of this panel about our focus group session? So 30 seconds, please. Thank you.
speak up because I did forget a point. One of the really key ideas, I thought this was a great idea, and if someone is listening that can run with this, the panel brought up the need to have lactation support services in places where people are already gathering. So the same way that we have like clinics and CVS and Walgreens or whatever, having lactation, or even just any retail pharmacy, or the grocery store, someone even mentioned that, having a lactation support person that they can call on at nighttime, because when lactation support issues come up, they're not coming up during, it's not a hospital emergency, right? You can't necessarily wait on a doctor's appointment. So having someone that you can walk into a pharmacy and get that support on in real time, or even just a hotline that someone can call for lactation support, I thought that was a brilliant idea. So hopefully someone
Dr.
takes
Barnes,
that.
I see you nodding, right?
Run
Very
with it.
well. Yes, thank you. Yes, Mr. Williams.
Yeah, I think one of the things that was sometimes really challenging in the space was seeing or hearing some of the women who are currently pregnant kind of talking about their experience, but then also have people who've given birth and talk about their experience. And so you can imagine someone currently pregnant hearing all these statistical things of why this outcome may not be positive and having to sit and hear that. And so I think as people, clinicians, pharmacists, navigation, community health workers, that we also need to be mindful about the audience we're sharing this with too, because we don't want to induce fear as well. So I think where we can be positive and be empowering for people to make decisions that are patient-centered, I think that is a step in the right direction. Given that we don't want to, quote unquote, sabotage someone by, also disconnecting, right? I hear that a lot. We need to disconnect, and then you disconnect, and then you also don't get the information either. Yeah.
Absolutely, very well said. We don't want to propagate fear into the community, but instead let us empower them. Let us empower ourselves to make right decisions. Very good. Thank you so much. Yes, Ms. Shields.
Yeah, I think my call is just in general, like to the folks here and to the folks that are online. I now, since you're sitting and you've heard, you now have allyship with the work. And so you've heard the good, you've heard the bad, you heard the things that you can do, and then there are some things that you may not be able to do. But take what you can and don't just sit on the information. Be an ally, be a true ally, so that we can move the needle on some of the things that need to be moved. So that's just my call to the audience that's listening, and thank you.
Thank you very much. Yes, Jasmine.
Yes, I think what LaToya said earlier about maternal health being complex is kind of like my summary. I think it's complex, so we need as many people being brought to the table to discuss these issues, because maternal mortality doesn't just affect the mother and baby, it affects families and communities.
Entire community. Awesome. Thank you very much. Please give it up for these amazing panelists. Please, thank you very much. I appreciate you, and I will turn it back to Dr. Oloriyomi. Thank you.
Thank you. Thank you so much to the panelists. Give it up for the panelists. Thank you. That was important discussions being made. Thank you so much. We're moving right to the next portion, which will be the Maternal Health Proclamation by Harris County Precinct 4, Office of Commissioner Leslie Briones. And this will be done by Marisol Valero Torres. Marisol Valero Torres is a dynamic leader dedicated to creating opportunities for people of all ages to thrive. A first-generation graduate of the University of Houston, Marisol's journey from being a former DACA recipient and VAWA survivor to becoming a U.S. citizen reflects her resilience and commitment to service. She currently serves as the Senior Director of Recreation and Programs for Harris County Precinct 4, Office of Commissioner Leslie Briones, where she leads strategic planning for programs and initiatives across 10 community centers, creating spaces that foster wellness, learning, and community connection. Marisol's passion for uplifting communities is matched by a civic engagement through organizations like the League of Women Voters and the Mayor's Advisory Council of New Americans. Please welcome Marisol. Thank you.
Thank you so much. On behalf of Commissioner Leslie Briones, I just want to thank everyone, every single person, every panelist, those of you who are attending and here for the very first time. I welcome you on behalf of her. Everything that I've heard here so far, it just makes me even more engaged, and I just want to be able to say to you all are welcomed here. You know, I heard from the previous panelists, moms and babies are a priority. We welcome all, no restrictions. You are not alone. We are here to empower. We are here to facilitate access, and we have a role to play. And that is exactly what Commissioner Briones and her staff are here to do for everyone in Harris County. And so I just want to emphasize that we have 12 sites, 12 community centers across Harris County that every single one of you have access to. And if you are a nonprofit organization or a Harris County department, there is no cost. And so you have free access. You have free access to our space or our technology. We also have interpreters. So if at any point you do have a conference such as this, or something else that you would like to have and have access to community members, and you are looking for interpretation, translation services, we have that access for you and can provide it for you at no cost whatsoever. And we also have social workers on site as part of Commissioner Briones' health priorities. Social workers are part of our team. We have them here as well, and so please feel free to access that service. And in addition to that, we have a mommy room. And I am just going to grab every single pamphlet that I see here and put it in that mommy room so that the moms that come to our community center have that access as well. But without further ado, my role here today, and that it's just to thank, on behalf of Commissioner Briones, the folks who worked so hard to put this event together. And so if I may have representatives from TSU and specifically, let's see, one moment here. Specifically, Dr. Adrewole Wema and Cecilia Torres, come up. Yes, please. So I'm just gonna read this real quick as you all are making your way here, but the Honorable Harris County Precinct 4 Commissioner Leslie Briones hereby recognizes Texas Southern University on the occasion of the Maternal and Child Health Education Conference today, January 30th, 2026. As Precinct 4 Commissioner of Harris County, Texas, and on behalf of the constituents of Harris County, it is my privilege to recognize Texas Southern University on the occasion of its 4th Annual Maternal and Child Health Education Conference. I thank you for your dedication and incredible community service. Your work has made a huge difference in creating positive health outcomes in Harris County, and I greatly appreciate your dedication and expertise. Congratulations on another successful event, and I wish you many years of continued success. It is an honor to host this special event, and I hope to continue to partner with Texas Southern University to serve mothers and children in our community. Thank you so much.
Thank you. Thank you very much. Thank you very much. Maybe we can take pictures. Okay, thank you. Thank you so much, to Precinct 4, Commissioner Leslie Briones, and a special shout out to Jonathan. Where is Jonathan? Where are you? Hey, he is like, oh my goodness. Thank you so much. Thank you, Jonathan, for making this happen, all the, logistics and everything in between. Harris County, Precinct 4, it has been a pleasure partnering with you all. You have made it very seamless. We've been doing this. I've had the privilege to lead community engagement since 2020, and I say this is one of the best partnerships we've had till date. So thank you so much. And I would like to invite up all our staff members to please come over so that we can take pictures with the proclamation. MH Rich and CBMHR. And the breast center too, TSU Breast Center, MH Reach, and CBMHR, please. And all members of the audience, please permit us for a few minutes while we take these memorable pictures. Thank you so much.
What the plug?
So happy. Okay, please help us to.
Oh yeah.
Yeah.
Sorry.
Thanks.
Sorry. I got unlocked.
Okay. Perfect. Thank you. Thank you. Thank you so much. I know we've run over time just a bit, but now we are going to go into our closing remarks and announcements. Thank you all for those that are still online, engaging with us, and for the room that is still full, almost at full capacity as when we began. How many people know that, do agree that today has been purely amazing? Right? Would you all like for us to have this again next year? Are you excited? I am. Because please save the date. 2027, Friday, January 29. By the grace of God, January 29, 2027, we will be having our next maternal and child health education and outreach. As we move along, today we've talked very much about women's health. And as we speak currently, we have women on the mobile units receiving screening mammogram at no costs. Right at this moment, I have the privilege to lead the breast center at Texas Southern, funded by CPRIT. And over the past 4 years, we have screened over 1,800 women. And we are just very grateful for that. Women are outside right now receiving their mammogram. But as we speak about maternal health, also keep in mind that your breast health is of importance to us. We have our table over there, Dolores and Monique. They are there ready to answer your questions. But also, save the date. We will be having this series of webinar called Is Screening Mammogram a Painful Experience? I turned 40 last year, so I got my mammogram for the first time. And when I was going, I'm like, okay, is this going to be painful? You know, how am I going to feel? But now I have an experience, right? Maybe I should be on the panel, Dr. Obo. I don't know. But anyway, we have this happening in March, so please save the date. And also, our big and bold breast cancer event is going to be on TSU campus in October. So it's way back there, October 30th this year. Please save the date for that as well. We've talked a lot about research programs and different opportunities, but one of the things that Texas Southern also has the privilege to lead is that TSU has now become a clinical research site. I am very excited about that. Mark is at the back. We have our table there for our Center for Clinical Research and Translational Sciences. So I do invite you all to join us in April, on Saturday, April 18th, by the grace of God. We will be having our conference on clinical research and engagement. It is again in collaboration with Princeton 4. Please give it up for Princeton 4 again. It is going to be at the David Weekly Community Center. Richard and Meg Weekly Community Center. So please save the date. Saturday, April 18, 9 a.m. to 3 p.m. in person, as well as online. A big shout out again to all our partners, Princeton 4, BBC Wellness Center, Harris County Public Health, The Rose, Breast Center at TSU, all our sponsors, and to all the amazing vendors, all around the room. Thank you all so much for supporting the success of today's event. I also want to give a big shout out to all our program staff. Please, program staff, thank you all so much. Cecilia, thank you. You saved the day, okay? So the back end of this story, when we were trying to prepare, I was a little bit overwhelmed, and I told Dr. Lai, I'm like, Doctor, I don't want to do a big scale event. Then Cecilia came. She was like, no, Dr. Ajawale, I got it. So thank you, Cecilia, for picking it up and for helping us to plan and successfully implement this. As a leader, I tell my team when I'm vulnerable, I tell you guys I'm tired, okay? But they let me, keep moving forward and keep doing the great work. Constellation X, thank you for supporting us, all our volunteers and all the different departments across the university. I also want to acknowledge my own husband. I think next year you need to be on the panel, okay? I do have my own personal maternal experience. I had to go through 4 C-sections in the delivery of our 4 children. And thank God for this man. He was there at every point in time. When they called the code blue, he was there. He witnessed every single moment. So we're putting you on the panel next year, babe. I appreciate you. Thank you so much for your love and for your support. Final reminder about surveys. If you've not done the surveys already, please do it. We are grant funded. We are held accountable. And we truly want to hear your feedback on what we should continue to do in the community. Before we go into our closing prayer, reminding you that we have vendors all across the room, and please remain seated. Lunch will be brought into the room after closing prayer. So please remain in your seats. We're going to pray, and then everybody will grab their lunch. Reminding you that we also have mobile units in the, in the parking lot. Please feel free to go there and receive whatever clinical services that you need at no cost. Lastly, it is my ultimate pleasure to bring up stage my own pastor, okay? I am very biased now. Miss Yolanda, she, God brought my family into Powerhouse Church at a critical point in time when a woman needs rest. And she told me it was okay to rest. I did not know it was okay to rest. Honestly, because I grew up just and resting was failure to me. Taking a break meant you had failed. But I had a session with Miss Yolanda, and she told me, Veronica, it's okay. Take a break. God is not going to get mad at you because you need this physical body to serve God and to function. So thank you so much, Mrs. Yolanda, for being that voice. And we are so blessed to have been under your leadership and Pastor Robert for these past many years. Miss Yolanda is a dedicated leader and a wife to Pastor Robert Burdett at Powerhouse Church. If I may please ask us to please help quiet it down a bit. Staff members, please help us to keep it down. We're about to pray. Thank you, everyone. And with a passion for nurturing faith across all generations, Miss Yolanda oversees the children's ministry, special needs ministry, and serves as a lead teacher for Awaken the church's women's ministry. She is a key visionary leader alongside her husband, where she plays an integral role in guiding the direction and growth of Powerhouse Church. Together, they have been married for 35 years. They are proud parents of 3 daughters and grandparents to 2 granddaughters. Please help me to welcome on stage my own pastor, Mrs. Yolanda Burdett. Thank you very much, Miss Yolanda. I appreciate you. Thank you. Yes, thank you. Thank you.
All right. If everyone could just stand up that's seated if you can. We need to stretch our legs a little bit, right? I'm going to take just a few seconds just to pray us out and bless the food. Dear Heavenly Father, we just thank you so much for being with us here. We thank you, Father, for all that have gone before us to do your work and research and all the work that it took to just present this information today. Father, in Isaiah 66, you tell us that from your character comes the care of a mother. Father, you have this character inside of who you are. And mothers have this care and comfort for their children. And we thank you for the opportunity to come alongside a mother's care for their child. We thank you for all the people that are being led by you, by being given the wisdom, Lord, to persevere through all that it takes to do something like is being done here today. We thank you that we don't do anything on our own efforts, but you are the one that is the creator of all. You are the one that gives us, Father, opportunities to be part of what you're doing. So we thank you, Father, and as we move forward from this time together, we pray that you will help us to be committed to the well-being of every parent and child in our community. And Father, may we take this wisdom shared today and turn it into action and ensuring that no mother walks her path alone or in the shadows. Father, maybe you give us the wisdom and the resources to continue to give to these mothers and children. Father, we thank you for everything that you have done here today and what you will do in the future. We pray that you will bless this food that will be given to us today. We thank you, Lord God, and we praise your holy name. In Jesus' name we pray. Amen.
Thank you so much, Miss Yolanda. And as we close out, a big thank you to Dr. Lale, Dr. Poon, and to all the leaders. We are very grateful. Now, please enjoy the food. And we hope to see you next year for Maternal event. And we have several other events in between. Thank you again very much, and God bless us all.
Hello. Thank you so much for joining us for today's program. My name is Veronica. I am the Program Director for the Community Engagement Corps here at Texas Southern University. I want to say a big thank you to you for joining us for today's program. I am certain that you have had a lot of great information that you will put to use within our community to advance health equity regarding maternal and child health outcomes. A big thank you to all our speakers and panelists, as well as to our sponsors, vendors, and exhibitors. I also want to say a big thank you to our staff members who worked very closely together in ensuring that today's program was a big success. We have a lot of great information and a lot of great programs coming up in the future, so please remember to stay connected with us on all our social media platforms at CECTX Southern U. Thank you again and see you around.
The main purpose of our Center for Biomedical and Minority Health Research is to address the existing disparities and